देखिए, मैं मेरा कुछ नहीं, नहीं वही है क्या? अल्लाह वाह!
This meeting is being recorded.
Good morning, everyone. Good morning, respected Dr. Sajita Madam, Dr. Vishala Madam, Dr. Subhasri Madam, and all the delegates who joined here through online. Hope my voice is audible to you all.
Yes,
Yes.
yes, very much.
Good morning. Very good morning to all of you.
Morning, Madam.
Good morning. Good morning, madam.
Good morning, ma'am.
So on behalf of Central Ayurveda Research Institute and CCRS, Central Ayurveda Research Institute, Bangalore, I would like to welcome Dr. Sulochana Bhatt, Assistant Director in Charge, Central Ayurveda Research Institute, Bangalore, Dr. Sajita K.S. Madam, HOD, Professor, Department of Swasthya, Sri College of Ayurvedic Sciences, Bangalore, Dr. Subhasri Eman, Research Officer, Central Ayurveda Research Ayurveda, Bangalore, and Dr. Vishala Turlapati, and Professor and HOD, Prasuti Department, Yashwant Ayurvedic Medical College, Kolhapur, and all the delegates for this session focused on hypothyroidism and PCOD. I would like to welcome you all in this session as a part of pre-presentation, this pre-conference presentation, which is being held at the part of this international conference of Ayurveda and integrative approaches to metabolic syndrome and obesity. So in this session, we will have total 12 presentations. This session is focused mostly on hypothyroidism and PCOD. So before formally starting this session, I would like to briefly introduce our all respected chairs and co-chair for this session. First of all, I would welcome Dr. Sajita K, Professor and HOD, Department of Swasthya, Sri College of Ayurvedic Science and Research. Madam is graduate and postgraduate in the Department of Swasthya. And she has more than 27 years of teaching experience. She has been PG teacher, PhD guide, and she has guided more than 15 PG dissertations. She underwent various training programs. She also organized various training programs like Swasthya 2004 at STM Hassan. Madam has been a resource person to various conferences and workshops. She is the member of a committee responsible for framing curriculum for UG and PG courses under NCISM. She has presented various scientific papers in various conferences and seminars, and she has more than 35 publications in scientific journals. So with this brief introduction, I welcome respected Dr. Sajita K. Madam. Namaste, Madam, and most welcome. We are very delighted to have you here in this session. Most welcome, Madam. Madam is currently, sorry, I forgot to mention, currently the principal of Sri Ayurveda College, Bangalore. Most welcome, Madam. Our another guest is Dr. Subhasri Eman. She is a research officer from Ayurveda specialty here in Central Ayurveda Research Institute, Bangalore. She is in charge of our OPD unit, and she is the member secretary of our institutional ethical committee. So she has significant experience in the field of clinics as well as in research. She is a graduate and postgraduate of MD Dravikuna, and she has secured 2 gold medals from Bangalore University during her study time. And before joining CCRS, she has worked at Ramakrishna Ayurvedic Medical College for 7 years. Then she joined here in CCRS in the year of September 2009. Since then, she has been involved in various IMR and collaborative research projects, including AMRA study, IUS study, and other international projects. She has presented more than 60 papers in national and international conference, and she has contributed in chapter in futuristic trends, is chapter in a book of futuristic trends in medical sciences, and another chapter on ethnobotany book. She has been a reviewer for more than 5 national and international journals, and she coordinates various programs, including pharmacovigilance and other conferences of national and international importance. So I welcome Dr. Subhashree Amman Madam to this session. Our another guest is Dr. Vishala Turlapati. I welcome Madam. Madam is a PhD from Kumar Bhatia Specialty, NIA Jaipur. Currently, she is working at Professor and Head of Department at Prasud Chandra Department, Yeshwant Ayurvedic Medical College, Kolhapur. She has more than 26 years of academic and clinical experience, and she presented more than 26 research papers. And she has been guest speaker and to various training programs, and she has delivered lectures at various orientation and reorientation programs, including topics including Uttarpasti, infertility, endometriosis, yoni ursa, and its effect on the fertility. She has been resource person to various conferences conducted by All India Institute of Ayurveda, IIV, ITRA, Jamnagar, SBM, ODP. She has been a organizing secretary and president of various conferences or seminars organized by the various institutes like Kashyapi, Ankur, like Dakshata, and she has been this editorial member for International Journal of Ayurveda Medicine and Darpan Scientific Journal. And she is the president of Kashyapi Ayurveda Gynecologist and Obstetrician Foundation, Maharashtra State Chapter. So with brief introduction, I welcome you, Madam, to this session. We are very privileged and to have you all in this session. So I look forward to having you a very fruitful and productive discussion with you all. Thank you. So with this introduction, I would request participants to be ready with their presentation, as they already conveyed that their timeline is 5 + 1 minute. So within 5 minutes, they'll have to finish their presentation. So total 12 presentation that we will be having. So I will announce the name of participants for this session. First number is Dr. Amrita Lakshmi T. Second presentation will be Dr. Varsha Murthy. Third presentation will be Dr. Pallavi NN. Fourth, Dr. Priya S. Fifth, Dr. Lavanya. Sixth, Dr. Harshita. Seventh, Dr. Gayatri. Eighth, Dr. Manjula Arkachari. Ninth, Dr. Rashmi T. Shetty. 10th, Dr. Jayashila Goni. 11th, Dr. Preeti M. Pujari. 12th, Dr. Pujita. So with this opening remark, I would request Dr. Amrita Lakshmi T. to start his presentation. Dr. Amrita.
Good morning, everyone. Am I audible?
Yes, madam. Yes, please.
I will just share the screen. Let me know if it's visible. Is it visible, sir?
Yes. Your screen is visible and your voice is audible.
Is it moving? Is the slides are moving?
Yes, it is moving.
Okay.
Namaste, respected judges and organizing team. Thank you for giving me this opportunity. So my presentation for today is hepatic imperative, correcting the
Keep your presentation open.
Hello.
I request to other participants, please be on mute. Please mute your mic so there will not be any disturbances during the session. Whoever is not presenting, please be on mute. Other participants. Okay, please.
Okay. Yeah. So my presentation is to highlight the importance of thyroid liver axis in hypothyroidism. See, thyroid liver axis is a bidirectional axis which is intrinsically linked to each other. So Yकृत, that is the liver, is the primary site of T4 to T3 conversion, because T3 is the active hormone, which will be useful in metabolism. And it is as I said, it's a bidirectional. So both thyroid can also influence liver as well as the vice versa. That is, liver can also influence thyroid hormones. So this can be evidently seen by looking at the prevalence of NAFLD in hypothyroidism patients, which is about 35 to 55%. And also, we can also see among the NAFLD patients, they have higher incidence of hypothyroidism. So this shows the link between the thyroid gland and liver. So coming to the thyroid liver axis. So liver is the central organ in thyroid hormone action, as it serves as the conversion site for T4 to T3. This is the influence of thyroid hormone over liver. So first is the lipid metabolism. Thyroid hormone plays a vital role in the equilibrium of lipid metabolism. That is, it increases the LDR expression, that is low density lipoprotein receptor. So which helps in the clearance of LDL, and it also helps in making sure there is no accumulation of fat, or it prevents the atherosclerotic conditions. And second thing is it helps in bile synthesis. So the active form, that is the T3, it stimulates the CYP7A1 protein, which is a very important enzyme used for cholesterol hemostasis, which is located in the liver. So when T3 acts on liver, this enzyme gets activated and it helps in the bile synthesis. The cholesterol is the precursor of bile acid, so it helps in the conversion of cholesterol to bile acid. And next comes the glucose metabolism. T3 regulates glucose hemostasis by modulating hepatic glucose output through the transcription of enzymes involved in gluconeogenesis and glucogenolysis. Coming to the influence of liver over thyroid hormones. So liver also has equally important role, such as liver is the primary site of conversion from T4 to T3. See, this is important because T4 cannot be readily used by the body, so it needs to be converted into an active form known as T3. Only then the body can be used for the metabolic purposes. So this can be carried out through enzyme type 1 iodothyronine deiodinase, that is D1 enzyme, which is exclusively found in the hepatocytes. And then here comes the transport. So once the conversion is over, the transport of the thyroid hormone is done by the thyroxine binding globulin. So this is also highly present in the liver cells. Then hormone metabolism. So liver is responsible for the conjugation and excretion of thyroid hormones. So these three are the very important roles of liver in thyroid metabolism. Next comes the liver dysfunction that are commonly found in hypothyroidism patients. So first and primary thing is impaired lipid metabolism. So first thing that is getting affected is the lipid metabolism. That is because of the thyroid hormone receptor, which leads to the increase in cholesterol and triglyceride levels. Once this lipids are impaired, they slowly or gradually progress to the next level, which is known as the MASL, the metabolic associated fatty liver. So this is because of the excess of fat being stored in the liver. And then gallstones can also be a manifestation of liver dysfunction in hypothyroidism patient. This is because, as I already mentioned, cholesterol is the precursor of the bile acids. So once there is excess of accumulation of cholesterol in the bile pathway, there will be supersaturation, which will lead to calculi formation or gallstone formation. So coming to the discussion, we have seen that the involvement of liver in hypothyroidism, and it can be seen with features such as dyslipidemia, NAFLD, presence of gallstones, or LFT being deranged, or even in some cases ascites can also be seen. So this particular features can be treated or approached in the line of Medharoga in Ayurveda. So coming to the possible samprapti, so frequent and excess consumption of kapha and medas vitiating ahara without any physical activity that is intake of more of goitrogen. When in modern science, we can take it as goitrogen or other food, not just goitrogen, even other food which may potentially affect the thyroid synthesis. They lead to the AMA formation due to obstruction of kapha and medas. So this can be understood by the disequilibrium in metabolism, and further it afflicts the rasadhatu, raktadhatu, mamsadhatu and medodhatu. This is where the hypothyroidism features start to exhibit. And furthermore, when it gradually progresses, it goes and affects the medodhatu agni. Now, when it comes to the medodhatu agni, that is when their lipid metabolism gets rearranged, and further there will be medo sroto sangam, and at last leading to the fatty liver. So this can be treated with the usual Medo-Roga Chikitsa, that is to correct the Agni, and Guru Apatarpana Ahara can be given, as well as Aushadas, Langana Vyayama and Sleshma Medohara Kriyas to be advised. Medicines which possess Katu, Tikta, Kashaya, Ruksha, Ushna and Tikshna and Lekana and Shoshana and Kapha Medohara actions to be used, such as Shilajitu, Gomutra, Gugulu and Triphala. These are the few formulations which can also be used in these conditions. So the conclusion of what I'm trying to convey with my presentation is that we have lots of correlations, Ayurvedic correlations for hypothyroidism. Many people treat it as Pandu, some people treat it as Medo, Shroto, Dhatu Agni Mandhyam. Some people treat it as Shotam, Kalagantam, and n number of conditions can be correlated. But when hypothyroidism is associated with lipid metabolism derangement or any kind of liver involvement, it has to be treated in the Medo Dhatu Mandhyam and Medo Hara Chikitsa to be used. So I would like to conclude my presentation with this. Thank you. Thank you for giving me this opportunity.
Thank you, Dr. Amrita. The session is open for questions. Any respected experts, if they want to ask any question from the presenters. Sajida madam. Yes, you are on mute, madam. Yes, your voice is not audible. One second.
Yeah. Now it is possible.
Yes, audible.
You have not specified any sort of liver protection drugs or liver corrective drugs or something here, isn't it? Can our Rohita have some role in this?
Namaste, ma'am, but I'm really sorry. I'm not able to hear your voice, ma'am. It's very low, ma'am.
Now can you?
Yes, ma'am. It's better now.
Okay. There is not much role for our Rohitaka or the combinations of Rohitaka to correct this condition when you are highly specifying the role of liver. The Rohitaka is starting any combination because Rohitaka is the drug of choice for liver diseases, isn't it?
So you see, whenever there is hypothyroidism patient in association with liver disorders, we can also go for Phalatrikadi Kashayam with Arogyavartini. This combination has been worked better in patients, ma'am.
Have you done any pilot study or something in such cases?
Not pilot study as such. We have given this for 3 patients and it has shown results. They are still under the study, ma'am.
Okay. Your way of explanation for Samprapti Vikatana or Samprapti is really good.
Sorry,
no doubt. How you explain the Samprapti is really very wonderful. It is good.
Thank you.
And I think much over concentrating on the Samprapti Vikatana may help.
Okay.
Thank you.
Thank you so much, ma'am.
Hello, Dr. Amrita.
Good morning, ma'am.
Good morning. Yeah, it's a nice presentation.
Thank you.
Just I wanted to know, you mentioned 3 cases you have a clinical experience.
Yes, ma'am.
So were they male or female?
Females, ma'am. All of them are females.
What is
females.
the age group?
Most of them were in the reproductive ages, ma'am. One patient was 28 years and the other patient was 32. One more patient was in her 40s. I'm not sure of the age.
Okay, so what treatment you have given to them?
Yeah, so we initially started with Deepanapachna and then we gave these internal medicines, Falatrikadi Kashaya, Arogyavardhini Ras. Also, in between, we also gave them Patola Katuroini Kashayam. Then the main treatment we focused on them was Snehapana and Virechana with
Okay, have you
Avipurinchol.
noticed any hormonal pattern in those female patients? Because estrogen will get conjugated in the liver, and you are more focusing in the Samprapti major role of liver only. So, any hormonal profile you have done, or any
Actually,
changes you have noticed in the menstrual pattern?
no, ma'am, we didn't take any estrogen or any such hormones. We were just focusing on the thyroid profile alone.
Because
But only,
thyroid is a major hormone which
yes,
is
ma'am.
connected to female reproductive system.
Yes, ma'am.
So you have not mentioned whether your 28 years female was a parus or she has children or not. So anyway, that would be an added advantage for your clinical study if you can approach like that.
Sure, ma'am. We'll definitely take it into consideration. Thank you so much, ma'am.
Yes.
Okay, so shall we move to next presentation, madam? Okay, Dr. Varsha Murthy.
Good morning, everyone. Am I audible?
You are audible, yes. Please put it on meeting mode, presentation mode, then.
Yes, sir. Yes, sir. Yes, sir. Just.
Please.
Good morning, everyone. My topic is decoding hypothyroidism, understanding etiopathogenesis involving dosha, dhatu, and agni. I'm Dr. Varsha Murthy from Government Ayurveda Medical College. My first slide is showing about the introduction wherein metabolic disorders occur when there is a defect in enzymes, hormones, or biochemical pathways. These defects interfere with energy production, synthesis, or waste elimination, ultimately leading to abnormal metabolite levels and impaired body functions. Hypothyroidism is one of the most common metabolic disorder characterized by reduced secretion of thyroid hormones T3 and T4. It may originate from the thyroid gland itself, which is called as primary thyroidism, or from the dysfunction in the pituitary or hypothalamus, which are secondary and tertiary causes. Clinically, patients often experience weight gain, cold intolerance, constipation, among many other symptoms. In Ayurveda, these features align with Agni Mandya, Kapha Vata Avarna Janya Vyadhi, indicating deeper derangement of the dhatus. The objective of today's presentation is to bring these perspectives together, classical Ayurveda concept and modern concept, to form an integrative view of etiopathogenesis of Vata Kapaja Vyadhi, particularly hypothyroidism. Methodology: both Ayurveda and modern literature were reviewed using Acharya Charaka's dosha assessment, stays the same across all the Vyadhis. Comparison of clinical feature of hypothyroidism was done with the Lakshanas and assessment was done. Here, the normal physiology is shown wherein the hormone regulation pathway controlling thyroid function. The process starts in the hypothalamus, which releases thyrotroponin releasing hormone. This TRH signals pituitary gland to release thyroid stimulating hormone. TSH stimulates the thyroid gland to produce the main hormone T3 and T4. This regulated system keeps hormone level balance, ensuring the body's metabolic stays on the track. Disruption at any point of this may lead to hypothyroidism. Hypothyroidism can be classified based on the problem originates. It can be primary if the cause is in the thyroid gland itself, wherein TSH level will be high and T4 will be low. Then secondary hypothyroidism due to pituitary gland dysfunction leading to low TSH production or normal free T4. In tertiary hypothyroidism arises from the hypothalamic dysfunction where TRH production is insufficient and free T4 is low. There is subclinical type also wherein TSH is more, free T4 is normal, and its cause may be due to thyroid dysfunction or autoimmune condition like Hashimoto's. This slide shows about the symptoms of hypothyroidism. So, for example, general systematic, if we are taking, there is reduced metabolism, wherein the main symptom will be weight gain, fatigue, and weakness. If we are taking gastrointestinal, there will be slow gut motility leading to constipation. Then neurological or cognitive, wherein reduced neurological activity or memory slowing, poor concentration is seen. This helps to recognize as the symptom of the disease, but also impacts the overall health of the patient. Herein, I'm showing the samprapti of kapha avritta vata vyadhi, wherein nidana, which can be aharja, viharja, or mansika, it will lead to the vata kapha vriddhi, leading to the jataragni mandya. The ama formation will occur, which will lead to the rasa dhatu will not get properly function. Then Dhatu Agni will get hampered and Uttara Dhatu Poshana will not occur. It will lead to the Dhatu Poshana Pradosha. And thus the Lakshanas such as Thaulya, Gaurava, Manda, Cheshta are seen. This is a combined samprapti wherein it is showing like correlating both modern and the Ayurveda samprapti. So what happens whenever we take Ruksha, Shita, Laghu, Guru, Ahara, there will be prakopa of kapha and vata, which hampers the agni, which can be jatara and dhatu agni. It leads to the derangement of the function of either thyroid, pituitary, or hypothalamus, decreases in the production of the hormones such as T4 and T3, metabolic disruption will occur, utpatti of lakshanas. In Ayurveda, we can see kapha avritta vata, lakshanas such as gaurava, alpa cheshta, shaitya, stimita. On the right hand side, we can see the modern hypothyroidism symptoms which are like similar, such as weight gain, slow pulse, cold intolerance, dry skin, etc. This slide shows about the symptoms, dosha, strotas, and guna involvement, wherein the symptoms such as fatigue or loss of energy, it is due to the dosha, kapha, and vata. Strotas, which is affected, is rasavaha, and guna involved is ruksha, chala, and manda guna. Constipation is occurring due to the increase in the vata dosha. Strotas affected is Purishavaha strotas, and guna involved is Ruksha and Shita guna. Weight gain may be due to kapha, increase in the kapha dosha, and strotas affected is Medovaha, leading to the gunas involved such as Guru, Sthira, and Mridu. In the same way, I have correlated to the other lakshanas or the symptoms. Moving to the next slide, the discussion and conclusion. It is telling about the hypothyroidism is a kapha avritta vata, meaning vata is obstructed by the kapha. Therefore, treatment should focus on three things: reducing kapha, then clearing the strotas, and restoring vata balance. Here, for example, Kanchanara Gugulu as an example is taken, wherein which does all the three actions mentioned above. And the concentration in here should be Ayurveda emphasizes understanding of dosha and avarna over the main or name of the vyadhi. If a condition does not respond to the standard treatment, that is upashaya and anupashaya, it may be due to avarna janya vyadhi caused by obstruction, and thus the avarna janya vyadhi treatment should be started. So managing hypothyroidism in Ayurveda focuses on each person's dosha samprapti, purusham hi viksham. That means that each and every individual is different. So disease manifests differently in each person due to variation in the dosha, dusha, agni, srotas, prakriti, and samprapti. Thank you.
Thank you, Varsha, for your presentation. I request experts for questions.
Varsha, it is a good presentation.
Thank you, ma'am. Thank you, ma'am.
Vishala, madam.
Dr. Varsha.
Yes, ma'am.
You have done elaborated study of decoding the hypothyroidism with dosha samprapti Have you tried any adopting this Samprapti Vikhatana in any clinical cases?
No, ma'am. I have not, ma'am. But
Okay, so
during OPD
what
basis,
expectant outcome you are expecting? And can you adopt it in the clinical cases, the same Samprapti?
yes, ma'am, based upon the patient, ma'am, by assessing the patient, ma'am, I can, ma'am. What type of ahara, what type of vihara the person is living. Based upon these, we can, ma'am.
Yes, and until have you gone through any implementation in any published journals? The same Samprapti for treating the patients of hypothyroidism?
No,
Have
ma'am.
you ever gone through? No. Okay.
No, ma'am. Ma'am,
Okay.
like I've gone through the articles. However,
Okay.
nowhere they have mentioned the Samprapti in an elaborate way
Okay.
in the hypothyroidism, ma'am.
Okay. I
And
wish you adopt this and check for the next presentation, clinical aspect of this same Samprapti and its Vigatana.
thank you, ma'am. Ma'am, as I'm a Roganidana PG, so
Yeah.
like I focused on Samprapti, ma'am.
So you have limited yourself to till this. Okay. Okay.
Subhashri madam will ask.
Dr. Varsha,
Yes,
uh,
ma'am.
antithyroid antibodies, the role of antithyroid antibodies here.
Ma'am, in the subclinical type, in the Hashimoto's hypothyroidism,
Yeah.
ma'am, the antibodies are produced by our own bodies against the thyroid gland. So it thus attacks the thyroid gland, and there is reduction in the thyroid hormone production. However, initially, like it is not seen, but as the time progresses, the thyroid level really drops down low.
Yeah, that also could be thought of adding there. Otherwise, it's a good presentation.
Okay, ma'am. Thank you, ma'am.
Okay, thank you, Dr. Varsha.
Thank you, sir.
Next is Dr. Pallavi. Dr. Pallavi Anand. You can stop sharing your screen, Dr. Varsha.
Yes, sir. Am I audible?
Yes, yes. Please share your screen.
Yes, sir. Is the screen visible, sir?
No, not yet.
Now is the screen visible, sir?
Yeah, yes, I think yes.
Yeah.
You put your password, yes.
Okay, sir.
Yes, yes. Please proceed. Yes, sir. It is
Good morning to respected judges and one and all present here. Myself, Dr. Pallavi NM from Government Ayurveda Medical College, Mysuru. My topic for today's presentation is environmental and dietary toxicants in thyroid hyperactivity and Ayurvedic perspective on etiopathogenesis and management. Now, what is the background and clinical issues? Thyroid hyperactivity is characterized by excessive thyroid hormone production, increased metabolic rate, weight loss, tremors, and heat intolerance. And increased evidence links environmental and dietary toxic exposure to disturbances of thyroid hemostasis. From Ayurvedic lens, this maps to the Agni Dushti, vitiation of Pitta and Vata dosha, which primarily involves the Rasavaha and Medovaha Shrotas. Now, the aim is to integrate the modern toxicology of endocrine disrupting chemicals with the classical Ayurvedic etiopathogenesis and management. Now, what are the dietary and environmental toxicants? What are the modern evidences? The many chemicals which are endocrine disrupting chemicals affect the thyroid structure and function. Example, heavy metals and pesticides. Heavy metals like cadmium, lead, mercury are associated with the altered thyroid hormone level. And the pesticides, evidence that organochlorine and organophosphate pesticides disrupt the thyroid hormone production, iodine uptake, binding, and signaling. And excess dietary iodine also can trigger thyroid hyperfunction in susceptible individual and thus represents the dietary toxicant. The diets what we take as a healthy foods like the fish, dairy products, etc., also contains the EDCs, that are endocrine disrupting chemicals when taken in excess. And what is the mechanism of disruption? EDC may damage the thyroid tissue structure and impair the hormone synthesis, disruption of the thyroid hormone signaling, altering synthesis and secretion, disturbed hypothalamo-pituitary thyroid axis, and competitive binding at T3, T4 receptors, reduced transporter or deiodinase functions takes place. And altered molecular mechanisms like increased oxidative stress, epigenetic changes, activation of signaling pathway, and induction of autophagy in the thyroid cells occur. And what are the dietary and the nutritional link? The micronutrient deficiency or imbalance in the micronutrients such as iodine, selenium, iron, and zinc modulates the susceptibility. And how to integrate the modern and Ayurvedic models together. The modern toxicology identifies specific chemicals and mechanisms disrupting thyroid hormone regulation. Ayurveda provides a systemic and holistic models which are called as Visha, which we can correlate it to toxins. And this metabolism also we can correlate it to Ama, and impairment of Agni by the dosha imbalance. And disease is caused specific to the Rasavaha and Medavaha Shrotas. For example, heavy metal exposure, it can cause the tissue damage by increasing the oxidative stress. In Ayurveda, it can be correlated to Visha and Ama, together causing Pitta aggravation, Agni dysfunction, and symptoms of hypermetabolism. And what are the preventive emphasis? The emphasis is to remove or minimize the toxic exposure and to restore the Agni, pacify Pitta, and to clear the Ama. And what are the Ayurvedic management principles? Primary aims are Vishahara Chikitsa, Pitta Shamana therapies, restoration of Agni, Shodhana procedures such as Virechana and Nasya when indicated, and Rasayana to establish the endocrine function and to strengthen the systemic resilience. And by modifying lifestyle, that is Dinacharya, Rutucharya, diet purification, and environmental awareness. These are the primary aim in management of thyroid hyperactivity. And some of the herbs with adaptogenic, antioxidant, and detoxifying roles can be used. Example, Guduchi, which has immune modulating and toxin clearing action, and Punarnava, which has diuretic and detoxifying action, and Ashwagandha, which has adaptogenic and helps in modulating metabolic and hormonal activity, and Triphala, which cleanses the bowel and it has antioxidant and supports the Agni. These herbs can be discussed as a part of regimen for detoxification, Agni improvement, or dosha, which means it can use either for Shodhana, Shamana, or for Rasayana. And what are the practical Ayurvedic treatment protocol? And in initial phase, diet cleansing, avoiding toxic exposure can be used. And in main phase, Deepana Pachana therapies are useful, and Shodhana procedure like Virechana and Nasya can be adopted. And after Shodhana procedure, Rasayana can be adopted along with the Dinacharya and Rutucharya. And as a preventive strategies and public health implications, empower the patients and communities with the environmental awareness, that is to avoid or limit the exposure to EDCs like flame retardants, heavy metals, etc. And dietary purifications like maintaining the optimal iodine level and adequate micronutrients will be helpful. And the lifestyle changes to maintain the Agni is useful. And integrative approach is to combine Ayurvedic preventive and therapeutic model with the modern endocrine toxicology insights yields a sustainable framework for the thyroid hyperactivity. And to summarize, environmental dietary toxicants play a key role in thyroid hyperactivity. And the Ayurvedic model like Visha, Ama, and Agni Drushti aligns well with the modern pathophysiology. Hence, the management is to detoxification or Shodhana, and dosha pacification or Shamana, and Agni restoration, rejuvenation, and preventive lifestyle and diet modification. A holistic integrative approach enriches both preventive and therapeutic strategies for the thyroid hyperactivity. And these are the references that I have collected for the presentation. Thank you.
Dr. Pallavi. Madam.
Yes, sir.
Madam, any question?
Yeah, Dr. Pallavi, actually you highlighted the lifestyle modification, which is proven actually the skipping of the breakfast have a major impact on the influence on the activity of the thyroid. So I appreciate the presentation and definitely no doubt the modification at the lifestyle, mainly in the form of Dincharya, Ritujari and all, will definitely have a impact on the primordial level of prevention. So good presentation, good.
Thank you, ma'am.
Dr. Pallavi,
Yes, ma'am.
how to substantiate the role of Nasya here in correction?
As it is Urdhva Chaturgata Vikara, we can substantiate Nasya in the thyroid hyperactivity, ma'am. The Shodhana Nasya and Shamana Nasya is always helpful in the thyroid dysfunction. Hence, I have taken it as.
And based on the theory part, it's fine. But what is the role of, you have mentioned Amrita, Ruchi, Ashwagandha. Practically, have you seen few cases? Am I audible?
Pallavi, can you hear? Close.
Hello? Can you hear us?
Pallavi, Dr. Pallavi.
Are you there?
Yes, ma'am. Yes, ma'am.
Okay, I was asking whether you have mentioned about Ashwagandha, Amrita, Uruchi, based on the theoretical aspects. Have you seen the practical importance in any of the cases?
No, ma'am. In thyroid hyperactivity, if we consider it as Ama and Agni Pushti, for the initial phase, for the correction of Agni, we can use those drugs for the pacification in the modulation of the Agni. But in practically, we give in OPDs, we give the Pitta Aushadas for the like management of Jwara also, we can do in the thyroid hyperactivity because of the increased metabolic rate. To reduce the metabolic rate, we can use the Pitta Dravya and immune modulating drugs for the patient.
Okay, any others?
Dr. Pallavi, Dr. Pallavi, can you hear me?
Yes, ma'am, I can hear you, ma'am.
Can you justify the role of Virechana instead of Vamana?
Yes, ma'am. In thyroid hyperactivity, basically it is because of aggravation of Pitta. Increased metabolic rate, we always correlate it to Pitta.
Why is it breaking, Pallavi?
By the Pitta, we can justify Prakopa.
Hello?
Yes, ma'am. In thyroid hyperactivity, the metabolic rate is usually increased due to Pitta. For pacification of Pitta, since Virechana is important, we can adopt Virechana in hyperactivity, ma'am.
Okay, and you have mentioned about integrated approach. Exactly what do you mean by integrated approach?
In the patient, usually a patient come to us along with the thyroid medications, long-term usage. After the long-term usage of thyroid medications, they come to us. So initially, we cannot suddenly stop the medications. Hence, along with the medications, we can adopt our Dinacharya, Ritucharya and Shodhana procedure. After assessing the thyroid hormone level, we can gradually decrease the hormone supplements.
But that's not integrated approach.
Yes, ma'am. But initially, suddenly we cannot withdraw the medications. Hence, I have taken it as like that.
Of course, but that's not, you cannot call it as integrated approach.
Okay, ma'am.
Integrated approach should have both the systems role equally with an evidence base. This cannot be
Okay,
an
ma'am.
integrated approach.
Okay.
Okay. Nice comparison you have done.
Thank you, ma'am.
Dr. Pallavi, thank you. Next presentation is Dr. Haripriya.
Yes, sir. So is the screen visible?
Yes.
Or can I start, sir?
Yes, please proceed. Yes.
A very good morning to one and all respected judges. I'm Dr. Haripriya, second year PG scholar, Department of Dravya Guna Vijnana from JSS Ayurveda College, Mysore. And I'm presenting on the topic Healing Thyroid Holistically, a synergistic approach through Ayurveda and modern endocrinology. So, if you see, according to recent projections, thyroid disorders affect over 1 in 10 adults globally, with women 8 times more prone than men. And according to ICMR and the Endocrine Society of India, they say yearly about 42 million cases of thyroid dysfunctions are reported. And thyroid is a very important part of the human endocrine system because it is responsible for the regulation of oxygen usage, basal metabolic rate, as well as cellular metabolism and growth and development. And through the activation of certain genes, these thyroid hormones, they stimulate protein synthesis, promote the maturation of nervous system, and increase the rate of cellular respiration, thereby elevating the basal metabolic rate. So hypothyroidism is generally described as an underactive thyroid that does not produce enough thyroid hormones, causing an overall decrease in physical as well as the mental activity. Now, in a modern endocrinology, mainly it is a hormone replacement therapy that plays a very important role. And here, does not treat the root cause, but the drug has to be taken for a longer duration. And in 3 forms, it is given, that is desiccated thyroid, leothyronin, as well as levothyroxine. And it is seen that sometimes T3 rises to supernormal levels during absorption phase, associated with palpitations in the person taking it. And also, it has one more drawback because it requires twice daily administration because of its plasma short half-life. And some adverse effects that are seen because of taking these pills include cardiovascular changes like shortening of systolic intervals, increase in the atrial beats, left ventricular hypertrophy, and also reduced bone density and bone mass. And on longer duration, they had transient effects like skin rashes, itching, and mild leukopenia. And in exceedingly rare cases, dangerous effects like agranulocytosis, aplastic anemia, lupus erythematosus, and vasculitis are also seen. So mainly the pathophysiology here is based on the hypothalamo-pituitary thyroid axis, where the hypothalamus releases the thyroglobulin releasing hormone, where in turn the pituitary releases the thyroid stimulating hormone. Thyroid secretes the T4 and T3, and the liver converts inactive T4 into active T3. And whenever there's a high T3, T4, there's a reverse mechanism sending a negative feedback to reduce the TRH and TSH secretion. So whenever there is chronic stress, there is an increase in the cortisol levels, and cortisol disrupts this pathway, causing an imbalance in the thyroid hormone production, causing dysregulation in the thyroid hormone. So the clinical features mainly, according to modern, I have tried to correlate mainly based on the Manda Agni, that is mainly Manda Jatra Agni as well as the Datra Agni. And here weight gain and poor appetite can be seen because of the increased Guru Guna of Kapha, as well as the Vriddhi of the Medu Dhatu and Mamsa Dhatu because of the improper nourishment to the Rasa and Rakta, as there is a hampered Jatra Agni. And puffy face, vitiated kapha obstructs the Rasavashotis, causing the puffy face and edema. Feeling cold because there is decreased pitta as well as increased Chita Guna of the kapha and the vata. Excessive sleep because vitiated rasa and kapha can induce sleepiness, and dry and coarse skin because rasa dhatu is not properly formed. In turn, rakta dhatu is not properly formed, causing dryness, as well as there's tvak parushita because of increased ruksha guna of vata dosha. Then tiredness and dyspnea because the ahara rasa is not properly formed, causing apakwa avastha, resulting in rasa dhatu dushti, uttara dhatu dushti, leading to reduced ojas and causing daurbalya. Constipation, again, because of the increase in mandaguna of kapha and the analomana gati of vata is hampered. Hair loss because kapha and rakta does the samrodhana of the romakopa, causing hair loss. And poor memory because kapha is mainly vitiated here, resulting in reduced Deha Bala, Agni Bala, as well as Mano Bala. And hoarseness of voice, the Swarabheda is one among the Kaphaja Vikaras, as well as Mandaguna of Kapha produces hoarseness of voice. So all this dosha imbalance as well as the Agni imbalance can be drawn, a conceptual parallel can be drawn between this and the hypothalamo-pituitary thyroid axis. Mainly, the core here is the metabolic as well as the hormonal disruption. So some key Ayurvedic herbs, the mainly popularly used Kanchanara Guggulu. When we see, it is shown that Kanchanara and Guggulu, they act synergistically to dissolve glandular toxins and normalize metabolism by enhancing the peripheral thyroid conversion. And the Guggulu sterols that are present in Guggulu has shown thyrotropic effect. That is, it stimulates the thyroid glands to produce hormones. Next, we have Krishna Jiraka, Nigella sativa, the bioactive substances that is thymoquinone and cymin. It is proven to improve the total triiodothyronine levels. Then the famous drug Hamsapati, when it was given in a single case report, it is reportedly reduced TSH values from 6.35 to 4.65 in over 6 months. And also there was symptomatic improvement that was seen. In one more study, Methika and Lashuna extracts were given, and it was seen that they lowered the serum concentration of T3 and T4 in hyperthyroidic rats. And we have one more drug called as Markandi and a component called as forcipolin. It activates adenylate cyclase and increases the CAMP pathway, which is very important in promoting T3 and T4 secretion. Next, we also have a drug called Mundi. The flavonoids present in these drugs enhances thyroperoxidase enzyme, which is a very important catalyst in the production of T3 and T4, and also the triterpenoids present in Mundi. It increases the plasma-free T3 and T4 levels and also reduces the TSH levels. Then we have Medhya Dravyas like Brahmi, Jyotishmati, and Shankapushpi, which are indirectly acting on thyroid health by regulating the HPA axis by reducing cortisol as well as oxidative stress. And there have also been studies showing how these are affecting thyroid health. So, as already told in previous sessions, that how liver plays an important role in thyroid. It converts most of the inactive T4 and into T3, and it also regulates the thyroid hormones and binds them to transport proteins, maintaining the steady circulatory levels. So, whenever there's a hampered liver function, there will be slower clearance as well as conversion. So, in Ayurveda, there is a cause of Manasika Nidana also causing Rasavaha Shroto Dushti. And even cortisol imbalance and inflammation can disrupt this liver-mediated hormone metabolism. So we very potent liver protective drugs in Ayurveda like Bhumi Amalaki, Shigru, and Bilva, which can also be used in thyroid dysfunction. So when we are coming to integrative approach, what we can expect from integrating modern endocrinology and Ayurveda, according to me, is maybe enhanced hormone conversion from T4 to T3, reducing inflammation and oxidative stress at the liver as well as the HPT axis levels, improved hepatic detoxification with the help of herbs, and also maintaining the psychoneuroendocrine balance. So to conclude and future directions, an integrative approach to thyroid disorders focus on treating the root cause rather than merely managing symptoms like in modern endocrinology. And the Ayurvedic herbs, they act on the liver to enhance T3 to T4 conversion, as well as on the HPT axis to restore the hormonal imbalance. So it's similar how in an orchestra, only one organ cannot be tuned and all the instruments have to be tuned together to get a pleasant music. Similarly, all our organs have to be tuned from the HPT axis to the liver and the thyroid to get a holistic effect. And this approach can be done only by integrating modern as well as Ayurvedic medicines. These are my references. Thank you.
Thank you, Dr. Haripriya. Madam?
Yeah. Dr. Haripriya,
Yes, ma'am.
it's a good presentation, and your selection of drugs are also good. No?
Thank you.
Sarah, madam, you want to ask something?
Yes, Dr. Haripriya, it's good
Yes, ma'am.
presentation. What you have put forwarded, the pathophysiology and how the Ayurvedic herbs are working. Do you have any evidence-based references for those?
Yes, ma'am. All this information I've collected from research articles, ma'am.
Okay. And
Yes.
yeah, animal studies or human studies?
A few drugs are clinical trials, but most of them are from animal studies only.
Okay. Okay.
Thank you.
Okay, so we shall proceed with next presentation, Dr. Lavanya. Thank you, Dr.
Thank you, sir.
Dr. Lavanya.
Yes, sir. So is the screen visible?
Yes, the screen is visible, but your voice is quite low.
So am I audible now?
Yeah, you are audible, but please come closer to your microphone.
Okay, sir. Namaste all. Myself Dr. Lavanya. I'm from Sri Sri College, Bangalore. The title of my presentation is Hypothyroidism through Ayurvedic lens, daily and seasonal regimens. So background, hypothyroidism characterized by underactive thyroid gland. Am I audible?
Yes, you are audible, but your voice is still a little low, but it's fine. You can proceed. Yes.
Time is running out.
Hypothyroidism is a common endocrine disorder characterized by an underactive thyroid gland, leading to weight gain, lethargy, peripheral edema, difficulty in concentrating, depression, etc. In Ayurveda, this condition can be viewed under Santarpanajanya Vikara. Improper sleep cycles, lack of physical activity, poor eating habits, and high screen time contribute to a sedentary lifestyle that disturbs the natural circadian rhythm, affecting thyroid function and disrupts the metabolic functioning. Based on the signs and symptoms of the disease, there is involvement of kapha and vata vitiation majorly in case of hyperthyroidism. There's usually the Tridosha Prakopa here, but majorly Kapha and Vata can be seen based on the symptoms. So materials and methods. A literary review was conducted using Lagatrai, Brihatrai and other journals. A short questionnaire was passed on to 20 Ayurvedic practitioners, and their observation regarding the diet and lifestyle pattern is being collected. So two of the questions I have put it in the slide. So the question is, what foods are recommended to be avoided or reduced intake in case of hypothyroidism? So I've listed out few of the like millets, dairy products, sprouts, non-veg diet, out of which millets was shown 30% and dairy products 40%, sprouts 20% and non-veg 10% in the persons who are suffering from hypothyroidism. And other question goes, have you advised them to follow any dinacharya procedure? So in that, Vyayama was almost 32% and waking up early in the morning 60%, and then Abhyanga in 8%, and Vishvartana it is not advised usually. So this is based on the practitioner's viewpoint. So we'll go to the review. So Santarpanajanya Vikara includes symptoms like Atisavya, Alasya, Gurugatrata, Buddher Moha, Shofa, and the other symptoms also. So amongst these, Atisthaulia, we can relate it to the obesity or weight gain, which can be seen in hypothyroidism, Alasya lethargy, and Gurugatrata means heaviness in the body, and also peripheral edema, mental confusions, which are commonly seen in hypothyroidism. So the causative factors of Santarpanajanya Vikara include Navarna,
Madhya, Anupamamsa, Divaswapna, Shaya Asana, Sukha. So when we say hypothyroidism and the diet, so millets usually it is in the current era people do consume it a lot. Amongst them, pearl millet is considered as a goitrogen based on few studies, and also people do eat a lot of sprouts in nowadays. In our science, it is considered as vatakara when it is taken without any samskara. So discussion on pathology, when we see, so improper sleep cycles, lack of physical activity, poor eating habits, high screen times, and major other dietary nidanas also will lead to the metabolic disturbance, leading to Jatragni and Datvagni Dushti. And these disturbing the circadian rhythm leads to vitiation of kapha and vata, and the leading to the symptoms which I have told before, the kapha and vatakara symptoms leading to underactive thyroid gland. Next, we'll go to the diet. So, in Ayurveda, it is mentioned Nitya Sevaniya and Nitya Ashilaniya Ahara. So, when we go to Nitya Ashilaniya Ahara, Masha is told, and Yava, Dadi, which are all Abhishandikara, and also as seen nowadays, the sprouts. So, whether it is good or bad. So, in Shishruta Sutrasthana, it is mentioned that so Anyonyanyapi Sanyogad Ahitani, so under which the Viruda is mentioned. So Viruda is refers to the sprouts, and also this Ama Mulaka, that is one of this radish which we eat along with the sprouts and other salads. It is considered as Tridoshakara. So as people nowadays eat a lot of sprouts on a daily basis, how can we make it in a more digestible form and then it can be consumed? So for that, we should use the samskara. That is like we can add cumin, mustard seeds, etc. to enhance the digestion and slightly cooking it and sagrita bharjana to avoid the vata prakopa. And also Dinacharya, when we see, Brahmi Murta is the first Dinacharya which is being mentioned, which is the major cause also, as nowadays due to night shift works or other studies and all, we do disrupt this normal cycle of sleep and wake cycle. So one of the major thing which we can include is Brahmi Murta, so that we can wake up early and also go to bed soon, so that the circadian rhythm will be balanced. And the other thing is Vyayama. So majorly even in the questionnaire also which was given, the Vyayama is majorly advised. So it helps in Doshakshaya and Agni Vriddhi, which is like majorly involved in hypothyroidism, the involvement of Agni. And Udvartana, it is not basically indicated by most of us in case of in general practice, but it is told as Medasaha Pravilayanam and Kapha Hara. So any general indications, or at least on a once in a week basis, we can actually advise the Udvartana. So another thing is Rutucharya. So based on Rutu wise, many diet is being told. So when we follow this, and also the dosha accumulation can also be expelled out by following proper Rutucharya. For example, in Varsha Rutu, there will be Vata Prakopa. So Snigdha Ahara has to be taken. So for example, Mamsa Rasa along with Grita can be taken for proper easily digestion. Conclusion. The regimens mentioned in Dinacharya and Rutucharya can be adopted for proper maintaining of metabolic functioning. For instance, Vyayam mentioned as a part of Dinacharya helps in combating the excess weight gain, which is one of the presenting feature of hypothyroidism. The abdominal exercises, Pilates, etc. helps in maintaining the proper metabolic functioning of the body. The Sarvangasana regulates the proper functioning of the thyroid gland. Udvartana using Kolakulatadi Chola helps in reducing the Vata and Kapha accumulation in the body. Following proper Dinacharya and Rutucharya helps in expelling out the accumulated doshas and maintain a balance, thereby preventing the manifestation of hypothyroidism and also in maintaining the balance of the thyroid hormones. Thank you.
Dr. Lavanya, thank you.
Lavanya, are you able to hear me?
Yes, ma'am.
Lavanya, actually you have to realize the limitation of the preventive modality. Yes, hope is there because you may have to segregate the high risk group and can advise the primordial. Basically, primordial levels of prevention may play a major role. And I have a doubt here. You were repeatedly saying Udartane is not practiced. Can you give the rationality? Why?
Ma'am, can you repeat the question, ma'am?
And in Udartana, you were saying 2-3 times that it is not recommended, right?
Yes, ma'am, on a daily basis, ma'am.
Okay, being a part of the Dincharya, you are, I mean, Rithucharya, you are
As a
saying
part
that,
of
isn't it?
Dincharya, it is not indicated.
Okay. Udartana is not recommended in all Ritus, no? Maybe in selected Ritu only we will do, right?
Yes, ma'am. So considering,
Good presentation. But realize the limitation once, okay?
yes, ma'am.
Anybody else, or shall we proceed with next presentation? Vishal, madam?
Yeah. Yes, no question.
Okay, thank you, madam. Dr. Harshita. Dr. Harshita is next. Dr. Harshita, can you hear me? I think Dr. Harshita is not there. Next, Dr. Gayatri. Dr. Gayatri J.
Yes, sir.
Yes, Dr. Gayatri.
Sir, is the slide visible?
Yes, slides are visible.
1 minute.
The last one.
Yes, please put it
Yeah.
PPT mode and.
Sir, is it okay now?
Yeah, it's visible, but it's not in presentation mode. Yes, now it's fine. Yeah, please proceed, yes.
Okay. Good morning. Myself, Dr. Gayatri J, second year PG scholar from Department of Kaya Chikitsa of SJCCH Chennai. So my topic is unveiling MAFLD in patient with hypertriglyceridemia, a convergent integrative approach. So MAFLD is no longer a liver disease, it's a metabolic disease driven by hypertriglyceridemia. It's now a global health issue affecting 30% of the global population, wherein 51% are progressing to NASH and about 40 to 41% are progressing to fibrosis and cirrhosis. This disease usually results in insulin resistance, wherein there is increased lipolysis in the adipose tissue. That will lead to more amount of free fatty acids into the liver. It's expanding the liver's capacity, so there will be overload of the hepatocytes leading to hepatic steatosis. So to combat this, liver produces more VLDL, still worsening the situation. So this is a case report of 56-year-old female, complaints of right abdominal discomfort, generalized body ache, tiredness, and bloating since 3 months. And also she has a history of diabetes mellitus and under medication for the same since 1 year. During Ashtavida Pariksha, the malam was katina, jihva was lipta, and the akriti was thula. And also in clinical examination, the BMI was higher, indicating overweight as per WHO criteria. So the diagnostic assessment was done based on the objective parameters, which were the USG findings that showed grade 2 fatty liver changes, and there was a T-arranged lipid profile. So on the basis of the subjective and objective parameters, this case was diagnosed as Ekritodara Sahita Medodrishti. And the treatment protocol that was followed was on the first day, Sadhya Virachanam was given with the Avipatti Churnam 25 grams early in the morning with honey, and 12 Vegas were noted. For the next day, Pachanamrita Kashaya and Chandraprabha were given. And on the next visit, patient complained of slight right abdominal discomfort frequently. So Kala Shakadi Kashayam and Nimbamrita Erindatahilam were given along with Chandraprabha Vati and Trifla Gugulu. On the other visit, patient had a concern about the weight. So Vidalveradi Kashayam was given with Hingu as the Anupanam, and Lashunadi Vati was given 1 tablet in the afternoon in between the food. And then to maintain, Vasa Gudachiti Kashayam, Dhanvantara Gudika, and Supapedi Gudika were given. And as a part of Rasana therapy, Shilajit capsules and Chandraprabha Vati were started. So these were the results before and after treatment. Before treatment, the USG showed that of grade 2 fatty liver changes, and after treatment, there was no significant abnormality noted. The serum triglyceride before treatment, it was 371,
and after treatment it was 168. The serum cholesterol level before treatment it was 321, and after treatment it was 186. So there was a significant improvement in all the parameters. So now let's come to discussion. So how this was diagnosed as Ekratodara Sahita Medodushti was, whenever Aharam is taken, it undergoes different Avasthapaka and it reaches the liver. So when Agni is good, along with the other entities like Pachaka Pitta, Kledaka Kapha and Samanavata, it does its job correctly. So we know Sarve Rogapi Mandagno Sutaram Udaranicha. So when there is Manda Agni, it leads to Udaram. So this Manda Agni will cause the Ama Yukta Dhatu formation. So when Ama is there, there will be Srotavarodha. So when Srotavarodha is there, there will be more increase of Kapha in the body. And as per Ashraya Ashrayi Bhava, the Kapha and Medas are related. Also, this Medas shares a guna, which is Sneha Gunam with Pittam. So when Pittam is involved, automatically Rakta is also get involved. So the Agni is hampered now, and there will be formation of Abdha Meda and Durmeda in the body. So this gets accumulated in the liver, causing the vitiation of the Medo Dhatu, leading to Medodushti. If we see, and this culminates in MAFLD. And if we see the rationality behind the treatment, so as per Vagbata, he says, yet anyasthana gateshu abaleshu agantushu sthani dosha sambandhini chikitsam kuryat. So always we have to treat the sthana dosha first. So that is why Sadhyu Virechanam was given with Avipatti Churnam, that reduces the Pitta dosha and also helps in proper movement of the Mala. And after Virechanam, the Agni will be Manda. So to combat that, Pachanamrita Kashayam was given as it has Tikta and Katurasa. And Kalashakadi Kashayam, which is directly indicated in Shula, and also it is Vatanalumanam too. And Vidal Viradi Kashayam is indicated in Staulya, and it is Kapha Medognam. The Nimba Amritadi Eranda Thailam and Sukhabedi tablets were given as a part of Nitya Virechanam, as Chakradatta mentions that in all types of Udara, I mean Sarva Udara, Nitya Virechanam has been indicated. And the Chandraprabhavati and Shilajatu capsules were given as a hepatoprotective drugs and also as a Rasayana therapy. So I conclude my topic by saying, Vikaranam akushalo na jihriyat kadachana nahi sarva vikaranam namato asti dhruva sayeva kupita dosha samuthana visheshataha samuthana visheshamscha buddhva karmam samacharit. Thank you.
Thank you, Dr. Gayatri.
Yes, Gayatri. Dr.
Yes, ma'am.
Gayatri.
Yes,
Gayatri,
ma'am.
you are speaking about one Vigalvairadi, isn't it?
Sorry, ma'am.
Vigalvairadi Kashayam something.
Yes, ma'am. Yes, ma'am.
Where that reference is? For my
Vidalveradi Kashayam is in Sahasra Yoga, ma'am.
It's popularly used.
Sorry, ma'am.
Is it very popular? Actually, I think you are from
It is
Chennai,
available
no?
in Kottakkal, ma'am. We are
Kottakkal
using it
have
here.
Varadi, no?
No, ma'am. The Varanadi is also there. Vidalveradi is also there.
Varanadi is different, Varadi is different.
Okay, ma'am.
Have you tried it to the patients, this Vigalvairadi?
Yes, ma'am. This is a case report, ma'am. So we have given Vidalveradi and it is indicated in Staulya.
Vigalvairadi's production is there from Kottakkal. I will check it, okay? Anyway, good presentation. Thank you.
Thank you. Thank you.
Sara madam.
It's a good presentation. Some clinical significance you have given. Just I wanted to ask you, what was the dose of Avipattika Churna you gave?
25 grams were given, along with
25
honey.
grams? Along with honey?
Yes, ma'am. Honey as the Anupana.
Okay. How many days you have given? Only single dose?
Yes, ma'am. It was a Sadhyu Virechanam, ma'am, for Kosha Shuddhi.
Okay. How many Vegas?
12, ma'am.
12 Vegas with 25 grams.
Yes, ma'am.
Okay. That's a surprising thing because so far I have never seen 25 grams dosage with 12 Vegas. Because it is the metabolic slowdown is also there in your patient.
Sorry, ma'am.
Metabolic syndrome is also present now in your patient.
Yes, ma'am. Yes, ma'am.
Definitely, Costa would have been Krura Costa only.
She had the Katina Mala, ma'am. But when we started, when we given Avipatti Churna 25 grams, she had 12 Vegas. But
okay.
Maybe
And,
because of the amatvam, the koshta, the mala may be kathina.
And why you have selected Avipatti Karachurna? Can you justify? Is there any specific reason?
Ma'am, because like in Avipatti Churnam, we have Yosha, Trijataka, everything which is Ushna and Tikshna also. And Churnam is more palatable than the Lehya for the patients, one thing. And other thing is, when also it is good for since Sleshma Samsrishtatvam is there in this case. So that's why Churnam is being given, I suppose.
Okay. And for later Nitya Virechana, what you have advised?
Sorry, ma'am?
Later for Nitya Virechana, what you have advised?
Sukabedi Gutika and Nimba Amrtadi Eranda Thailam were given, ma'am.
So how many Vegas per day did she had with that in Nitya Virechana?
That I didn't, we didn't ask for it, ma'am.
That's important, no?
Yeah, yes, ma'am.
Okay. That's
Okay,
all.
thank you so much.
Dr. Gayatri, you showed the difference.
Yes, ma'am.
Before and after. How many days time period was there?
It was around 3.5 months, ma'am.
Oh. Nice to
Okay, Dr. Gayatri.
Thank you.
Okay, Dr. Gayatri. Thank you.
Thank you.
Next is Dr. Manjula. Dr. Manjula Arkachari.
Yes, sir.
Dr. Manjula.
Yes, sir. Sir, my voice is audible, sir.
Yes, yes.
Presentation.
Rashmi Shetty is showing, I think. You both are joined from same device.
Oh.
Yes, sir.
Okay, fine. Yes.
Go ahead.
One
Yeah,
minute, ma'am.
Yeah, you can any sit, no problem.
It's not visible here, no? It is visible. No. Here. Here. The screen is visible, sir.
Yes, it's visible.
Yes. Okay. So shall I start, sir?
Yes, please.
Good morning to each and everyone present here. My presentation topic is on an Ayurvedic perspective of metabolic dysfunction associated steatotic liver disease. Content. Introduction. We on Sharira Rachana and Kriya of Yakrit and Medo Vahasrotas, understanding the concept MASLD through Nidana Panchaka, contemporary understanding of MASLD, discussion and conclusion. Introduction. Metabolic dysfunction associated steatotic liver disease, formerly known as non-alcoholic fatty liver disease, refers to a spectrum of liver conditions characterized by hepatic steatosis, that is fatty liver, in individuals with at least one cardiometabolic risk factor, example obesity, type 2 diabetes mellitus, dyslipidemia or hypertension. MASLD is a common liver disorder characterized by fat accumulation without alcohol use. It ranges from simple steatosis to NASH, that is steatotic hepatitis, potentially progressing to cirrhosis and hepatocellular carcinoma. The most accepted and unifying hypothesis to explain the pathophysiology of metabolic syndrome is insulin resistance, moreover, which results from an incompletely understood defect in insulin action. Conventional management primarily relies on lifestyle and dietary regulation with limited pharmacological options. Ayurveda provides concept named Vikara Vighatakara Bhava Bhava Under this framework, MASLD can be understood through Nidana Panchaka, Samprapti of Kapacha Prameha and Yakradaliyodhara mainly. Ayurvedic formulations, dietary regimens, and lifestyle modifications described for analogous conditions, particularly those under Kapacha Prameha and Yakradaliyodhara, were critically analyzed with their etiopathogenesis and therapeutic relevance of a holistic approach for prevention and management. Materials and methods, a comprehensive review of classical Ayurvedic contexts to establish conceptual correlations between MASLD and Ayurvedic doctrines, Ayurvedic formulations, dietary regimens, and lifestyle modifications described for analogous conditions, particularly those under Kapacha Prameha and Yakradaliyodhara, were critically analyzed with their etiopathogenesis and therapeutic relevance. View on Sharira Rachana and Kriya, that is, Garbhasya Yakrit Plihano Shonitajo. Yakrit takes the origin from Shonita. This plays great importance in treating such cases. Yakrit is the Matruja Bhava. Medo Vahanam Srotasam Rukko Moolam Vapavahanam cha. Here, Vapavahana are the Mula of Medo Vahasrotas. Vapavahana is also a Matruja Bhava Avayava. Can be correlated Vapavahana with the organ which stores the Medas. Contemporarily related directly to the pancreas, it can also be taken as the abdominal organs which store some extent of fat in it. Medo nama Sandra Sarpis Tulyaha Snehadatuhu Sharirasya. Tasya Sthanam Udarantaha. This shloka plays a great importance to understand the diseases of the Yakrat can be correlated as liver. So, the Medodhara Kala, that is the Trutiya Medodhara, here it says the Medodhara Kala which is having its origin and seed in Udarastham. So, it says it will be present in the organs of the abdomen. So, it will be in the form of Sandra Sarpihi. How the Sarpi, the density of the Sarpi will be there. So, in that form, it will be there. That Sneha is only the Meda. So, this is the basic understanding of the Rachana and Kriya of the Medodhatu and Yakrit. Understanding of the concept of MASLD through Ayurveda is Rasanimittam eva Sthaulyam Karshyam cha. Tatra Shleshmalahara Sevino Adhyashana Sheelasya Avyayamino Divaswapna Ratasya cha Ama eva Annaraso Madhuratarascha. This highlights the Samprapti and which quotes that Rasanimittam eva Sthaulya. The Sthaulya and Karsha is because of Rasa, and that Rasa is because of Shleshmala Ahara Shilina and the Viharas also Shleshmakara, which results in Anna Rasa which turning to Ama, which is not going to form, which is not going to do its Paka properly, and it will be stays in the form of Ama. Sharira Manukramat Snehat Ati Medo Janayati. So, Ati Snehat Medo Janayati. So, finally results in the excessive medas. So, tad ati staulyam apadayati. So, this is the Samprapti of Santarpana Janya Staulya, which is because of mainly Rasadushti. And coming to the Charaka Samhita Nidana Sthana, that is under Prameha Nidana Samprapti, here, Saprakupitaha, along almost all the Santarpana Nidanas were explained. And the Samprapti goes like this. Kshiprameva Sharire Visruptim Labhate. So, that Medas, that Abhadda Medas, which Visruptin, that spreads all over the body, that is Sharira Shaithilyat, and because of that Sharira Shaithilyata. So, Visarpan Sharire Medaseva Adito Mishri Bhavam Gachati. So, that Bahu Abhadda Medas, which and kapha which get mixed with each other, medasascha eva. And not only this cha indicates it is not only with the medas, and also we can understood that along with other sharira kledas it is going to mix and it is going to spread, it is going to carry towards each and every channels. Based on that, we will getting the respective sampraptis of the vyadhis. So here I am highlighting the Visarpan Sharire Medasevadito Mishri Bhavam Gachati, the samprapti in this MASLD. And coming to the Charaka Chikitsa Sthana 13th chapter, so it is under Plihodara that can also be considered for Yakrutodara, that Shunita and Rasa etc. dhatus, when it gets excessively, and that does the Vivardhana of that organ, that Pliha or the Yakrit. This Samprapti is tell, and we will look to the schematic of MASLD is goes like this. Amashayagataha pakvam maharaha prapya kevalam pakvah sarvashayam paschat dhamanibihi prapadyate. So, amashayagatas, that pakva ahara does the pakva that get digested properly, then it circulates all the ashyas. So, this is how whenever there is an improper paka of the ahara rasa, and that pakva ahara is being carried to this organ, that is yakrat also. This can be understood as the histological organization of the liver and showing the accumulation of intracellular triglyceride droplets within hepatocytes due to impaired Jataragni and Dhatavagni paka of ahara rasa. And coming to the flow chart, that is ahara rasa and the Jataragni, the prasada bhaga and kitta bhaga from ahara rasa, it is going to form, and this is prasada bhaga is being acted by the pancha bhutagnis, that is Prithvi, Ap, Teja, Vayu, Akasha, and here the main dhatu up bhutagni, which going to act on the ahara presence with predominantly of up Mahabhuta Pradhana, which is going to increase the kapha dosha vriddhi, and indeed the Medo Dhatavagni, if it is in improperly presented, that is that Agni is not proper, then it leads to Abadha Medas, and this Abadha Medas being carried through the Medovaha Srutas and along with the Mishri Bhava with Bahutrava Shleshma, and it is going to form the Sthaya Medo Dhatu Nirmana and in the Shitila Dhatu. So what we had previously seen, that accumulation that can be considered as Shitila Dhatus, and finally leading to the adipose cells, the fat cells, lipid-rich organs, globulins, lipoproteins, LDL, HDL, VLDL, etc. And here we can understand that the Upadana Dravyas are present in Annarasa required for the synthesis of the constituents of the Sthayi Medo Dhatu. And this is how contemporary science we can understand the healthy liver is going to turn into the accumulation of fats and finally leading to cirrhosis and ultimately the hepatocellular carcinoma. And here the etiology and Samprapti and Lakshanas. Mainly the etiology is considered as the Shleshmala Ahara Sevana, Divasupna, Atisneha Sevana, Adhyashana Shilata, Avyayama, and Sukha Vihara. These are secondary pleasurable lifestyles which are leading to the Samprapti like this. Shleshma is going to Kshipra Prakopa and Sharire Visrupti, Kaphamedasa Mishri Bhavam, Medo, Bahu Abadham, Vriddhi, Vikrita Kabha, and Dushtameda, that is Dosha Dosha Samurchana, Sharira Kleda, Dusha Samsarga, and finally leading to the Meda Vriddhi Chakra, and leading to the Lakshana somewhere. The Atisthulata, Kshudrashvasa, Pipasa, Kshut, Swapnadhikyata, Sveda, and Gatra Dorkandhya, Gatra Sada, Gadgadattva, Sarvakriya, Asamarthata. So these are the major Lakshanas we can able to see in such patients, majorly or minorly. And coming to the adipose tissue mass, according contemporary understanding,
Manjula,
the adipose
Dr.
tissue
Manjula.
mass, which is going to.
Dr. Manjula, sorry to interrupt you, but please stick to your timeline, 5 plus 1 minute. It is
Okay, sorry, sir.
more than your time.
Okay.
Time to conclude. Okay. Other participants are also waiting.
Okay, sir. Sorry, sir.
Please conclude.
Sir. Discussion. The pathology characterized by hepatic steatosis driven by insulin resistance and related to cardiometabolic factors. Ayurveda correlations is understood by pathogenesis of Staulia, Kapacha Prameha, and Yakradalyodara. So it relates Kapha Meda Sankara, the central mechanism of Samprapti, the mixing of V-shaped Kapha. The slow metabolizing Medas perfectly maps to the cellular events in insulin resistance and dyslipidemia leading to fatty liver. Therapeutic intervention relevance with the Ayurvedic principles of Vikara Vighatakara Bhava Bhava. Treatment for Kapacha Prameha and Yakradal utilizes therapies Rukshana Lekhana Deepana Pachana Yakrututejaka designed to reverse the Kapha Meda accumulation, correct the liver metabolic dysfunction. And there are many research works on drugs which shows hepatoprotective activity such as Punadava Prangaraja, Sharapunkha, Amalaka Guduchi, Eshtimadu, Bimbi can be applied in patients according to the Nidana Purvaka Samprapti for better management. Mind body practices incorporate practices like yoga, especially asanas, pranayamas that activate the abdominal region, Kapalabhati, etc. and meditation. These practices manage insulin resistance and hepatic inflammation. Thank you, sir.
Thank you, madam.
Dr. Manjula, it was a very detailed one, but time is restricted, no?
Yes.
Anyway, congratulations, good presentation.
Thank you, ma'am.
Thank you, madam. Dr. Vishala, madam.
Yes, Dr. Manjula elaborate study you have done. Very nice. I think you are from Nidana department, right? If I'm not wrong.
Yes, yes, ma'am. Yes, ma'am.
Yeah, apart from this textual information, can you tell me which place you are working?
Ma'am, I'm third year PG, ma'am. Government Ayurveda Medical College, ma'am. Bangalore.
Bangalore, okay. So in
Yes, ma'am.
Bangalore, when you go through the patients, particularly what type of diet is mostly observed in resulting into this fatty liver disease, non-alcoholic fatty liver?
Mainly, ma'am, in our OPD, there are mainly actually Akala Bhojana, ma'am, and then almost the Maida prepared foods and junk foods and almost bread. The Maida prepared foods, I used to observe such Nidanas, ma'am. And apart from that, there are actually usually the curd intake in the night, I used to observe in many patients, ma'am. And moreover, that too with non-veg, excessive non-veg consuming patients.
Okay, so have you tried to incorporate this in your pathogenesis?
Yes, ma'am. I used to concentrate mainly on ahara, ma'am, in fatty liver diseases because they are accidentally diagnosed patients. I used to, and they were later they were worried about their fatty liver disease, and I used to target the actual samprapti, actual ahara nitra brahmacharya, the trayopasthambas. I used to try to correct them along with the medicines which are targeted to the Yakrut Uttejaka, ma'am.
Okay.
Yes, so thank you, Dr. Manjula. Next is Dr. Rashmi Shetty.
Sir, can I take 2 minutes? Sir, because of
yes.
some urgent assignment, I may have to step out now. I'm really sorry for that. With your permission, Vishala madam.
No problem, madam.
Very happy to hear you.
Yes, ma'am. Yes, I could not
Oh.
interrupt in between.
Yeah.
Namaste. I'm very happy to see you at least online.
Okay, madam. We have a meeting with the Gurudev at 10:45, so it is high time for me to move with your permission.
Yes,
Okay,
ma'am.
thank you. Thank you, sir. Rajendra sir. Shubha madam, thank you very much. Shubhasri
Thank you,
madam.
madam.
Thank you.
Sir, whether I am audible, sir, I am sixth participant, Harshita. Should I wait till the end, sir? Hello.
Okay, before I would like to request Dr. Arthita and all of you participants, please stick to your timeline. You need to finish within the assigned timeline. Okay, so 5 plus 1 minute. You have to conclude your presentation. Okay.
Okay. Sir, shall I present now or should I wait till the end, sir?
Yeah, please share it. Please share it. You can present now. Sita, you can present.
Okay, sir. Sir, is my PPT present? Is it visible, sir?
Yes, it is visible. Please.
Start.
Harsita?
Yes, sir, yes.
Yeah, please start.
Good morning, everyone. I'm Dr. Harshita, first year PG scholar from Department of Kaya Chikitsa, Government Ayurveda Medical College, Mysore. Today, I'm here to present on the topic of Ayurvedic insights and role of Apatarpana Chikitsa in metabolic dysregulation with special reference to hypothyroidism. We can see coming to the background of this presentation, we see the global rise of hypothyroidism and metabolic disorders in the recent days. So there is an increase in the prevalence rate of both the metabolic disorders and hypothyroidism, that is around 30% of metabolic disorder, prevalence rate of 30% of metabolic disorders, and hypothyroidism is 11% in India. So there is hypothyroidism is a condition in which the insufficient thyroid hormone leading to the reduced basal metabolic rate and weight gain, dyslipidemia, fatigue, and cognitive dullness in the patient, and also memory decline, dry skin, constipation. These are so many other symptoms that is seen in the hypothyroidism patient.
in the contemporary science, the standard care given is the levothyroxine replacement. So not only the medicine is important in this condition, because this is due to the increase in the sedentary lifestyle of the people. So there is a more need for the lifestyle integrated approaches to enhance the metabolism. So in Ayurveda, metabolic dysregulation can be understood as a Santarpana Janya Vyadhi arising from the Dhatvagni Mandya, for which Apatarpana Chikitsa is considered the key therapeutic strategy. So seeing the connection between the hypothyroidism and metabolic dysregulation, there is a mounting evidence highlights a bidirectional relationship between thyroid function and metabolic health. So hypothyroidism study shows that hypothyroidism has been linked with reduced insulin sensitivity, hyperlipidemia, elevated body mass index, and central obesity, all of which are the components of metabolic syndrome. So hypothyroidism is not that only it's pertaining to the one system; it is it is acting as a cause for the other metabolic disorders. So thyroid hormones exert the direct effects on the pancreatic beta cell function, hepatic glucose production, so that it is acting on the liver, and adipocyte metabolism, so that and peripheral glucose uptake via modulation of insulin receptor expression and activity. So it tells that thyroid is not only it acts on the single organ, it acts on the multiple organs, and there will be a constant low-grade inflammation in the body. So there is a study shows that there is an increase in the hypersensitive CRP levels in the body. So there will be a there is a continued chronic low-grade inflammation present in the body. So there is so when we do the approach for the hypothyroidism, so we should see in the view of the as a metabolic dysregulation. So coming to the Ayurvedic understanding of hypothyroidism, excess Santarpana Ahara. So nowadays we see the sedentary lifestyle that in aspect of both Ahara and Vihara, the excess of Santarpana, like consuming the Ahara that is which are overnourished, and Adyashana, Vishamashana, all are coming to the leading to the Santarpana, and Vihara, the very less physical activities are seen. So this leading to the ama formation in the body due to the Kapha and Medakara Ahara, leading to the ama formation in the body. So this does the Agni Mandyata. So it not only Agni Mandyata at both the level of Jatragni and Dhatvagni. So there will be initially it affects the Rasa Dhatvagni, and later Uttara Dhatus are also affected. So we see the symptoms that are pertaining to all the systems of the body. That is and the Medo Dhatu Dushti and Sroto Rodha, especially Rasavaha and Medovaha are majorly included, but all the other dhatus are also involved. So here that Agni Mandyata leading to the increased metabolism in the body, so leading to the hypothyroidism. So in Ayurvedic view, we can consider it as seeing from the view of Santarpana Janya Vyadhi, the Ama Pradosha, Tandra, Klaibya, Atistaulia, Alasya, Gurgatrita, Shofa, or the Lakshana seen in the hypothyroidism, and Rasadhatvagni Mandya Vyadhi, Ashraddha, Ruchi, Gaurava, Tandranga, Madda, Pandutva, Sroto, Rodha, Klaibya, Agni Mandya, and Asya Kafajananatmaja Vyadhi, Tandra, Nidra, Dikya, Gurugatrita, Alasya, Pakti, Atistaulia, and Galaganda. So all this Samprapti will leading to the is showing that it is a Santarpana Janya or Rasadhatvagni or Kafaja Nanatmaja Vyadhi. So all these diseases tells that it is a Santarpana Janya Vyadhi, and it is a Kapha Pradhana Vyadhi, and all these point towards the Apatarpana line of Chikitsa. So coming to the concept of Apatarpana Chikitsa, it's a treatment for the this overnourished condition. So Apatarpana is of 3 types: Langana, Pachana, and Doshava Sechana. And it tells that it is indicated in Prabhuta Shleshma Pittasra Mala Samsrishta Marutaha. So here we can see the Prabhuta Shleshma, and also this considering the sthana of the thyroid gland. Also it is in the Kapha sthana, and it is associated with some Vata. So reduce the Apatarpana Chikitsa does the it helps in the reducing the Kapha Meda Vriddhi. It enhances the Agni and clear the Sroto Rodha and facilitate the metabolism through Langana Rukshana. And it also includes Upavasa, Deepana Pachana, Udvartana, Ruksha Sweda, and Kapha Medohara drugs. So we see the Ama Lakshanas in these patients like Balabramsha, Gaurava, Anila Mudata, Alasya, Pakti, Klama, Malasanga, Aruchi. So all this again, it is leading to that Apatarpana Chikitsa is very essential in these patients. And also already told before, lifestyle modification is necessary. So in all the aspects of Ahara, Vihara, and Aushadha, all the approach should be in Apatarpana. So coming to the Ahara, in Apatarpana Chikitsa, they told that Charaka mentioned the Jirnashi. So it improves, that is consuming the food after the digestion of the previous meal.
So it tells that it improves the metabolism and assists the weight control in hypothyroid patients, and chrononutrition studies show improved glycemic control, lipids, weight. Next, coming to the Eva Goduma Bhojana, that Eva Goduma both are indicated in both Kashi and Staula Chikitsa. So that studies shows that whole grain intake linked to the improved BMI, lipids and reduced inflammation, supports the gut microbiome, influences the immune thyroid disorders. And Yoshadi Saktu is also mentioned in the Santarpana Janya as a Patarpana Chikitsa, that it the review article tells that the properties of Yoshadi Saktu as Kapha Vatahara, Tridoshara, Deepana Pachana, Anulomana, Lekana, Bedana, Chedana, and Medohara property, that it is a anti-lipidemic, hypolipidemic, anti-obesity, anti-hyperglycemic, and anti-diabetic, anti-atherosclerotic, and also cardioprotective properties. So that when we suggest the patient, we should tell them to take in the form of like Saktu, that is which is fried, and then taking the substance in case of Navadhanya or Navashali. Instead of that, when they Saktu is that which is a fried preparation. So this helps in the patient to reduce the overnourishment to their body. And Upavasa, coming to the Upavasa, it said the recent tells that the intermittent fasting modulated the limbic, dopaminergic, and TRS systems that regulate feeding and HPT axis function, which controls the metabolic rate, supporting this regimen as a suitable non-pharmacological strategy to treat the obesity. And coming to the Vihara, Vyayama Nityo, that increase the Deepta Agni Medasa Kshayaha. So Deepta Agni will increase. Now, the Vyayama increases the metabolic. Vyayama improves the metabolism, but no studies have conducted on the hypothyroidism. How exercises, only aerobic exercises shows the improvement in the thyroid function. Next is coming to the yoga, but a study of yoga shows that there is a yoga like Paschimottanasana, Sarvangasana, Bhujangasana, several other yogasanas and pranayama suggested that it acts on the thyroid function. Coming to the Aushada part, Chatushprakara Samshuddhi, Pipasa Maruta Atapo, Pachanani Upavasascha Vyayamascheti Langanam. So here we, based on the review articles, it says that Shroto Shodhana, that is mainly Vamana, considering the Vamana because of the Kapha Vriddhi and the Sthana of the thyroid gland. Vamana is very beneficial, that many studies have conducted on the Vamana. So it shows the very good result in the case of hypothyroidism. And considering this Sthana, Nasya can also be advised in the patients, that is with the use of Shadbindu and Anutaila. And for the Dhatvagni Deepana, Shadharana Churna, Panchakola Churna, Vaishwana Churna can be used. For Dhatugata Malapachana, Panchamrita Kwata, Gugulu Tiktaka Kwata, Guruchadi Kwata. And for Udvartana, it is Kafavara Medasa. Property, the Udvartana's property of Kafam Arha Medasa is useful in the hypothyroidism patient. So it increases the metabolic activity, improves circulation. So this can be adopted before the Shodhana procedure as a Rukshana for the before this Neyapana, we can adopt the Udvartana. And Shamana Aushadhi, that which possess the Kapha Medohara properties like Kanchanara Gugulu, Amsapadi Adi Kashaya, Ashtavarga Kwata, Navaka Gugulu, Punarnavadi Kwata, Asanadi Kwata, and Gugulu Tiktaka Grata. So all these medications will help in the hypothyroidism patient. Conclusion, hypothyroidism shows Kapha Meda increase and Manda Agni, making it as a Santarpana Janavadi. So Apatarpana Chikitsa is suitable as it reduces Kapha and stimulates Agni. So all this Langana, Rukshana, Deepana, Pachana effectively correct the metabolic imbalance in hypothyroidism. Thank you. Thank you for giving me the opportunity to present.
Thank you, Harshita. Sara madam, any questions?
No, sir.
Okay, madam. So we shall proceed with next presentation. Dr. Jayashila or Dr. Rashmi. Okay, Dr. Jayashila.
Rashmi nahi hua.
Rashmi. Dr. Rashmi. Rashmi Shetty.
Yes, sir. Yes. Sir, is my screen visible?
Yeah, I think it started sharing, but not yet visible. Yeah, now it's visible, yes.
So now?
Wait. Yes, it's visible.
Yes, sir. Thank you.
Good morning, everyone. Myself, Dr. Rashmi Shetty, second year PG scholar, JMC Bengaluru. I'll be presenting on the topic of environmental and dietary toxins in the etiopathogenesis of PCOD or PCOS and Ayurvedic insight. So PCOS, that is polycystic ovary syndrome, is a highly prevalent endocrine disorder with a heterogeneous spectrum of ovulation dysfunction, polycystic ovary morphology, and hyperandrogenism. And the global prevalence rate based on different diagnostic criteria used for PCOS varies between 2 to 21%. 85 to 90% of women with oligomenorrhea have PCOS, while 30 to 40% of women with amenorrhea will have PCOS. And in Ayurveda interprets PCOD as a Rasamedo Dhatu Vikara with similarities to conditions such as Yoni Vyapat, Nashtartava, Pushpagni, and Artava Dushti. So this is an attempt to explore the integrative understanding of PCOD by correlating modern toxicological insights with Ayurveda pathophysiology. Coming to the methodology, as per Charaka Chikitsa 30th chapter, he gives a Nidana for Yoni Vyapadas, Mityacharinata Srinam, Pradushte Nartavenacha, Jayante Bija Doshasha, Daivacha Shlosa Pratak, under which Mityachara includes Mitya Ahara as well as Vihara. Mitya Ahara such as excessive use of Madhura, Amla, Lavana Rasa Ahara, Guru Abhishandi, Shita, Snikta Aharas, and eating habits like Adhyashana, Vishamashana, Atyashana, Samashana, along with Pramita Bhojana. Whereas Mitya Vihara, such as faulty moods of following Dinacharya, Ratricharya, Divasapna, Ratri Jagana, along with excessive Shoka, Chinta, Bhaya, etc. As well as Rasavaha as well as Medovaha, Sroto Dushti Hetus can be considered, that is Guru Shita Matisnikta, Matimatram Samashkatam, Rasavahini Dushyanti, Chintyanam Chapi Chinta, as well as Medovaha Sroto Swapna Medyanam Chati Bakshanat, Medovahani Dushyan, Varunyasha Ati Sevanat. Coming to the contemporary science, that is certain food sources such as starch-based and dairy foods have been found to promote exaggerated insulinogenic responses in women with PCOS. The mechanism by which grains alter the endocrine system may be through their inherent phytoestrogen production, along with use of agricultural pesticide found to interact with thyroid, androgen, and estrogen pathways. Dairy products as well as whey protein have been found to increase hyperinsulinemia, subsequently hyperandrogenism in women with PCOS. Coming to the environmental toxin, especially endocrine disrupting chemicals, that is EDCs, are of particular interest to reproductive health, including PCOS. As a result of research made by EPA, 2 recent case control studies have investigated the association between concentrations of specific EDCs, such as serum levels of perfluorinated compounds, polychlorinated biphenyls, that is PCBs, pesticide, and polycyclic aromatic hydrocarbons among women with PCOS. There is also evidence indicating higher levels of bisphenol A, that is BPA, which is synthetic compound found to be present in women with PCOS compared with control subject. Decoding the Samprapti, that is Aharaja and Viharaja Nidanas, will cause formation of ama along with Medodushti, causing chronic Garavisha accumulation, leading to Srotoroda in Artavaha as well as Medovaha Srotas, with the doshas increased Kapha, Vata, Avaran, and Pitta Dushta, along with doshas such as Rasa Rakta, Meda as well as Artava, leading to the clinical manifestation, that is Artava Kshaya, Artava Dushti, Vandyatva as well as Medoroga Lakshana such as obesity, insulin resistance. Coming to the discussion, the very process of menstrual cycle has been explained by Chakrapani with the words such as Avirbhava as well as Tirubhava. And if we correlate the modern etiological factors as per classics, Charaka Vimana has explained Dushita Vayu, Jala, and Ahara in Janapado Dvamsa, which can be compared with the environmental pollution leading to the Visha Pravesha. And Garavisha as per Sushruta, that is, can be compared with the modern EDCs. And Amavisha, that is internal toxin, that is improperly digested metabolic waste, can be considered for hormonal dysregulation. Dana Parivarjana, Shodhana such as Vamana, Virechana, Basti as well as Nasya Karma, Shamana Aushadhi such as Artavajanya, Vata, Kapha, Shamaka, Agniya Dravyas, along with yoga and pranayama such as Uttana Padasana, Sarvangasana, Paschimottanasana, along with Pastrika and Ujjayi Pranayama. Conclusion, the yoni is the very root of women's physiology, and when the yoni is impure, the entire body remains in health. It is said that yoni srina moolam tasya shuddhi sharira shuddhi dosha sarvanga dosha tasya dushtam sarvanga dosha bhavati. And Ayurveda offers a holistic preventive and therapeutic framework for PCOD, along with the Nidana Parivajana, Dinacharya as well as Samshodhana as well as Agniya Dravyas, reinforcing the relevance of Ayurveda in modern metabolic and lifestyle disorders. Thank you.
Okay, Dr. Rashmi. Madam, any questions? Visala.
No, sir, no.
Okay. Okay, thank you, Dr. Rashmi. Next is Dr.
Thank you so
Jayashila.
much.
Dr. Jayashila Goni. Dr. Jayashila, are you there? Yeah, Dr. Jayashila. It seems not there. Dr. Preeti. Dr. Preeti Pujari. Dr. Preeti. She is also not there. Dr. Pujita.
So Preeti is there. She'll be coming.
Yes. Dr. Preeti, please share your screen.
Yes, sir. Yes, sir. Sir, is my slides visible? Hello?
Yes, please start.
Hello?
Yes, your slides are visible. Please start.
Okay, sir. Good morning, everyone. Myself, Dr. Preeti. I welcome you all to my presentation on the topic a non-pharmacological approach to treat PCOS beyond pills. Let your food and breath be your medicines. See, almost every family today has at least one or the other person struggling either with diabetes, hypertension, etc. These are all interconnected through metabolic health. See, most of the metabolic disorders don't start with bigger symptoms, they just start with tiny changes that we ignore every day, like poor sleep, cravings, constant fatigue, etc. So, what is metabolic syndrome? It includes all the diseases that results from disturbances in the body's biochemical metabolism. India, once which was predominantly affected by infectious disease, is now facing a burden of non-communicable disorder such as metabolic. So what has changed over these past few years is rapid urbanization, lifestyle changes, sedentary behavior, etc., which have contributed to marked increase in these conditions. Metabolic disease is diagnosed when three or more of the following are present, that is abdominal obesity, high blood pressure, low HDL cholesterol, increased triglycerides, and insulin resistance. So, what is PCOS? Is it hormonal or metabolic? We often talk about PCOS as a hormonal disorder, but the truth is, PCOS affects the entire body. That's why women of PCOS struggle low with energy, weight changes, cravings, blood sugar issues, etc. And it is also a common cause for ovulatory infertility too. According to Rotterdam criteria for PCOS, it includes oligoovulation or anovulation, hyperandrogenism, and polycystic ovaries. Next is insulin resistance. It can be considered as both effect and cause of PCOS because increase in insulin overstimulate the ovaries, causing them to produce more androgens, leading to PCOS symptoms. So, in many cases, it triggers the hormonal imbalance. Once when PCOS begins, the hormonal levels gets disturbed and this makes insulin resistance even worse. Next is obesity, that is due to hyperinsulinemia. It reduces the lipolysis and causes lipogenesis in the body. So Ayurvedic perspective of PCOS, while explaining various karmas of the doshas, Charaka explains Upachaya as the function of Shleshma, where Upachaya can be considered as one which helps for nourishment or one which helps for development. So development and enlargement of the follicle can be considered as the function of Kapha. And while explaining Garbha formation, he says Vayur Vibhajana. So Vata is helpful for rupture of the follicle and then expulsion, which can be considered as the function of Vata. Probable correlation of PCOS can be done according to Kashyapa, that is Pushpagni, where he explains Pratha Pushpa, which can be correlated to anovulation, Stula Gandha as obesity, and Stula Loma as hyperandrogenism. So, coming to the treatment aspect, most modern treatment always do not cure the symptoms. And after stopping the therapy, the result may not be obtained as such. So, currently, after understanding circadian rhythm, it became evident that timing of diet, sleep pattern, and daily activities plays a vital role in metabolic health.
The role of Dinacharya was felt so important by our ancient acharyas that all Brahatrayis have dedicated separate chapter 1000 years ago. So, importance of structured daily schedule and proper physical activity. Acharya Vagbhata says, in order to have Niroga Avastha, one must utilize Kala, Artha, Karma in proper way. And similarly, while explaining Artava Dushti, he explains Mithya Acharana, where Mithya Acharana refers to Asamyak Ahara and Achara. Coming to Brahmi Muhurta, see, our brain relies on regular signals like light, dark, sleep, and meal times. What happens is our body is designed in such a way that we have to wake up in light and rest with darkness since childhood. So circadian rhythm is innate and few genes regulates this rhythm, and its proper coordination plays a key role in regulating multiple physiological processes. Two major hormones are melatonin, which rises in evening, prepares the body to sleep, and disturbed sleep pattern suppresses the melatonin, causing poor sleep. Similarly, cortisol, which rises in morning, prepares the body to be alert and boosts energy. Improper sleep patterns makes the person sluggish and inactive. So when we wake up early, our body matches to the schedule of the circadian rhythm and let our hormones rise and fall at proper time. Next is Vyayama. Exercise usually demands energy and stimulates catabolic pathway like glycolysis, where there is production of ATP, and this ATP will be uptaken by skeletal muscles during contraction. As there is continuous glucose uptake, there will be lowered insulin in the body, which reduces the stimulation to ovarian thecal cells and causes decrease in androgen production. Similarly, continuous physical activity increases ATP demand in muscles and reduces the triglycerides by breaking the calories. So in present era, yoga is considered as most effective forms of physical activity which enhances metabolic function, reduces stress and supports endocrine health by regulating HPO axis. So coming to the importance of ahara, Acharya Charaka says Ahita Ahara Upayoga is a nidana for Vyadhi, and Ahara is considered to be Mahabhaishya according to Kashyapa. So, how does this food influence on hormones? Is increased carbohydrate diet increases sugar in the blood, causing triggering to the androgen production and weight gain, etc. And even highly processed or packaged food containing refined carbs, trans fats, and preservatives disrupts gut microbe and affect liver metabolism, which is the culprit for hormonal imbalance. See, our acharyas have also explained Nitya Sevaniya Dravyas, which comprise major nutrients like carbs, lipids, proteins, etc. And they have explained Padamshika Krama, where practice of improper diet should be reduced gradually. Coming to the conclusion, Yukta Ahara Viharasya, Yukta Cheshtasya Karmasu, Yukta Swapna Avabhodasya Yogo Bhavati Dukkaha. Proper sleep, nutrition, and physical activity are fuel to the body, which helps to maintain hormonal levels. So let us embrace lifestyle changes as a way of living, not just a rule to follow. Thank you.
Thank you, Dr. Preeti. Madam? Visala madam.
Yes, sir. So no questions.
Okay, thank you, madam. Dr. Pujita next. Dr. Pujita.
Yes, sir. Am I clearly audible?
Yes, yes. This would be the last presentation for this session.
Start.
Yeah, please start and conclude within the assigned timeline. Okay?
Yes, sir. Is it visible?
Yeah, your slides are visible, but you are in last slide, I think. You need to go to first slide, yes.
No, sir. Is it still live?
Very visible, but the slides are not moving. It seems some issue is there. Only last slide is showing. Thank you, slide. I think you need to go to first slide.
Oh. Okay, sir. Sir, now? Hello, sir.
Yeah, now it's visible. Explain please.
Okay, I'll start. Namaste, this is Dr. Pujita from Shishi College of Ayurvedic Science and Research, Bengaluru. Paper title, Ayurvedic Evaluation of Millets for Metabolic Disorders, Benefits, Cautions and Evidence. Guided by Dr. Ranjit Kumar Shetty sir and Dr. Shri Nagesh K.A. sir. Introduction. Millets are increasingly being promoted for managing metabolic disorders such as obesity and diabetes. Even modern research highlights their role in lowering blood glucose and lipid levels. However, Ayurveda classifies most of these grains as kudhanya, inferior grains, creating confusions regarding their suitability. This presentation aims to explain why millets are termed inferior and how to use them properly so we get the benefits without causing harm. Material and methods. Here I want to highlight that we did a small pilot survey with 30 Ayurvedic doctors and their observation on how people like millets. One thing I want to highlight right away is this: when asked whether they see patients with ill effects from improper millet use, 82% of the doctors said yes. This clearly shows why a study like this is needed. Now, what are millets? They are basically small seeded grains used for food. The ones we commonly know like jowar, bajra and ragi, they fall under the major millets, and grains like foxtail, prosa, etc. are under the minor millets. Now coming to Ayurveda, millets are listed under the Kudhanya Varga. Their general properties, they are mainly Vatakara, Laghu Ruksha, but Kapha Pitta Hara. Now about the term Kudhanya. Kudhanya iti kutsitani kudhanyani. And kutsita means nindita or inferior or despised. So naturally, many people assume these grains are completely condemned and shouldn't be used at all. Even in my survey, 43% of the practitioners said they don't prescribe millets, and one reason may be this label Kudhanya. But when we look at the text, millets like Kodrava and Shamaka are mentioned as Ekanta Hita, and some even as Patya in conditions like Prameha, Sthaulya and Raktapitta. So millets are definitely not completely contraindicated. So then why are they called Nindita? Probably because of their Vatakaratva, Ruksha nature and Baddhamalakara effects, which require caution. So overall, we can infer that Ayurveda does allow the use of millets, but wisely and only where appropriate and required. Now, discussion on the evidence and benefits. For the sake of example, I've restricted to obesity and diabetes mellitus. Many studies suggest millet diets lowers the LDL, VLDL. They're very useful in weight reduction. Similarly, in diabetes, their low GI makes them highly useful in this disease. Studies show they help reduce HbA1c. In Ayurveda, Sthaulya and Prameha, which are similar conditions, especially in Stula Pramehi, we can observe properties of millets are very much suitable to do the Samprapti Vighatana. Now coming to the cautions. How do we use millets correctly? The key is adopting proper samskaras and samyogas so we get the desired benefits like lekhana and kaphahara effects without increasing vata. Practices like soaking and fermentation reduce anti-nutrients which otherwise cause vata symptoms. Cooking improves digestibility and Sagrata Bhajana helps control the Ruksha nature and reduces constipation. Before prescribing, we must assess the patient's Prakriti, Vata status, Rutu Desha, Vaya, Agni, Satmya, and only then introduce millets gradually, that way in Padamshika Krama. Also, the specific properties of each millet should guide our selection. For example, in obesity, if the patient has PCOD or if planning for conception, then avoid avrishya dhanyas like pearl millet and sorghum. Similarly, customization is essential. In my study, 80% doctors observed sudden shift to millet-based diets among the patients. The harms of improper millet usage. For example, if a patient with obesity also has other vata disorder, for example, joint pain, giving millets wrongly might reduce weight but can aggravate vata. So such ill effects can be found. Most importantly, one example in Kaphaja Prameha, which is Sadhya, if we give millets without properly monitoring, we will only be pushing it towards Vataja Prameha, which is Asadhya. So this can be clearly inferred from Vataja Prameha Nidana, where they've told Kashaya Katu Tikta Ruksha Lagu Shita Ahara, which is very much similar to millet properties. And in my study, the commonly observed ill effects were 88% doctors observed impaired digestion, ama, bloating, 42% body and joint pains, and others like irregular periods, hypothyroidism, colitis, and abdominal pain. In today's scenario, many irrational health trends are rising. In my survey, 53% of doctors said they have observed patients consume processed millet snacks, assuming that they're healthy. But these are devoid of any samskaras. In fact, they involve dry heating, which further increase ukshata. And then we have multigrain mixes, which further increase heaviness and poor digestibility, and so on. Then there's the millet mix powder. We must note foxtail millet with milk is viruddhahara. So all such nuances has to be considered, and only then millet can be administered. Now coming to results and conclusion, although Ayurveda classifies millets as inferior grains, their use is not entirely discouraged but should be approached with caution. Millets are beneficial in metabolic disorders like obesity and diabetes, but should be avoided in Vata dominant conditions. Proper selection and preparation such as soaking, combining with suitable foods and introducing them gradually helps minimize harm and enhance benefits. Sudden dietary shifts or reliance on processed millet products can impair digestion and cause Vata Roga. With current widespread promotion of millets, emphasizing correct usage to Ayurvedic principles is essential. Further research should also examine the effects of irrational millet use, multi-millet consumption to strengthen evidence and prevent Vata-related imbalance arising from misuse. So we know that millets are great for the planet, and with the promotion of the right usage of millets, they could be great for the body too, thereby tending to both the Loka and Purusha. Thank you.
Thank you, Dr. Pujita.
Dr. Pujita, it was a good presentation.
Thank you, ma'am.
What was the most common complaint that you got from the survey?
So most common complaints was digestive issues like ama or atisara and bloating. These were the most common ill effects.
No history of, no complaint of amla pitta?
In my pilot study, I did not find such. But apart from the study, just yesterday I found a patient who told that their piles and constipation increased after taking millets.
Acidity was the most common complaint we got from a pilot study, similar to what you did. Okay. Madam, do you have any questions?
Yes, it's a nice presentation, Dr. Pujita. Actually, you have highlighted so far the community, public community, it was given a concept of millets means healthy version. But you very well highlighted what could be the other effects other than healthy benefits if not judicially administered. Considering the prakriti and other conditions, it can also be harmful. This is the most important point actually to be taken to the public, because nowadays it became a very common thing that everyone is advising and everyone is following blindly the intake of millet. Very well presented. Congratulations.
Thank you, ma'am. Thank you so much.
Okay, thank you, Pujita.
Thank you, sir.
Okay, so madam, with this presentation, this session ends here. I request you for concluding remarks. Dr. Vishala, madam.
Yes, sir. Yes, sir. Thank you, sir. First of all, thank you, the Kari administration for giving me this opportunity to judge this wonderful presentation. Almost all the scholars have presented very well. They have done very good study, review study they have done, and they've reviewed the publications and other articles. But what I could suggest few points is more emphasis towards clinical area would be more beneficial for the community. Like if any research is coming out, mentioning about at least case series or some pilot studies. So that would be helpful for the practitioners also, what to be followed and what not to be followed. So in that way, that would be improved. And the content also, what I feel, lot of content is dumped that can be reduced so that it would be more explanatory rather than anyway. I would congratulate all the presenters. They have done a very good job. So with these few comments, I'm taking leave. Thank you once again for giving me the opportunity.
Okay, okay. Thank you, madam. We will consider all your suggestions. We will try to incorporate. And on behalf of CCRS and Central Ayurveda Research Institute, Bangalore, I would like to extend our sincere thanks and gratitude for being part of this session. and providing your valuable inputs to participants. Thank you so much, madam.
Thank you.
And I would thank to other resource persons, Dr. Subhashri MN and Dr. Sajita KS madam also, for their valuable inputs and suggestions in this session. So I would need your permission to end this session here, and we will initiate the proceedings of next session. Thank you, madam. Thank you so much.
Thank you, madam.
Okay, Dr. Pujita, please stop your screen from sharing.
Lovely.
Can I just quit? I'm not able to stop sharing.
Yeah, no, I have stopped, no problem.
Okay, thank
You can leave if you are done, you can leave now.
Yes, please. Thank you.
Yes, madam. Okay. So thank you, everyone. So we shall begin with the next session, which is the last session of this pre-conference presentations. Session number 9. So very good morning and namaste to everyone. So with this session and with this session, new session number 9, this session is focused on yoga, diet and lifestyle. So on behalf of CCRS and CRA Bengaluru, I would like to welcome the resource person for this session, Dr. Savita HP, Professor and Head Department of Manas Yoga, SDM Hassan, Dr. Shiv Kumar Harti, Additional Professor and Head of Department of Swasthata from All India Institute of Ayurveda, New Delhi, and Dr. J.V. Ramana sir, Research Officer Ayurveda from from Regional Ayurveda Research Institute. So in this session, we will have total 12 presentations focusing on diet, lifestyle, and yoga. So each presentation will have a time of 5 + 1 minutes. I request everyone to conclude their presentation within 6 minutes. So before formal initiating this session, I would like to give brief introduction of our resource person who are chairing this session. So I would begin with Dr. Savita HP madam. So on behalf of organizers CRA Bengaluru, I would like to welcome Madam Dr. Savita HP Madam, Professor and Head Department of Manas Yoga. Madam is MD and PhD from the specialty of Manas Yoga, and she has been working in the subject of Manas Yoga at SDM Hassan for the last 18 years. She has guided more than 26 PG and 6 PhD students. She has published more than 35 research articles in various national and international journals. And she has done 2 research projects which are funded by CCRS as well as from Rajiv Gandhi University of Health Sciences. Currently, she is working on a project which is on alcohol abuse in a Chanarai Patna town, which is again funded by Ministry of Ayush. She has given many presentations in various national and international conferences, and she is a member of this curriculum drafting committee of NCISM. So overall, she is a dedicated academician and researcher with extensive contribution in Ayurvedic psychiatry. So I would like to welcome Madam, please. And with next resource person is Dr. Shiv Kumar Harti. He is additional professor and head of department, our Department of Swasthata, All India Institute of Ayurveda, New Delhi. He is a PG and PhD guide of University of Delhi, and he is heading one incubation center, which is a very innovative initiative of Ministry of Ayush, Incubation Center for Ayurveda Innovation and Entrepreneurship, briefly titled as iCANE. He is head of that incubation center. Basically, from study from KLE Belgaum and SDM Hassan. He is a PhD holder from KLE Belgaum, and he has teaching experience of more than 18 years, and he has completed more than 9 projects, and he has guided 19 PG students and 8 PhD students with research publication of more than 16 in various indexed journals. He is a invited guest speaker for various national and international conferences. So we are very privileged and delighted to have you, sir, in this session. Most welcome, sir. Dr. Shiv Kumar Harti, sir.
Yeah, thank you.
Welcome, sir. Our another resource person is Dr. G.V. Ramana, sir. He is from CCRS. Currently, he is working as a research officer in charge of Regional Ayurveda Research Institute, Goa. Previously, sir has worked in the Department of Swasthvrata at SDM College of Hassan as a professor, as medical superintendent and deputy medical superintendent before joining CCRS in the year of 2006. Previously, he worked as CCRS Jaipur unit, then in Nimhans, Bengaluru. Currently, he is in charge of Goa unit. Currently, he is working on 2 IMR research project and 1 collaborative research project as the principal investigator, and he has more than 50 publications as author and co-author for his credit, and he has guided 8 PG students under Swasthvrata department, and he is a member of editorial board of few index journal, and he is also engaged as a reviewer in this journal. So I welcome Dr. G.V. Ramana, sir, for this session.
Thank you, Rajendra ji.
Thank you, sir. Thank you. And we are happy to have you all in this session, and we look forward for very productive and fruitful discussion in this session. So I would announce the name of participant for this session, session number 9. So total 12 participants are there. First is Dr. Nand Kishore. Second, Dr. Lakshmi. Third, Dr. Swaruprani Sethi. Fourth, Dr. Priyanka Rathod. Dr. Snehal Kurle, Dr. Manjunath, Dr. Kiran Ilai, Dr. Mahima Rathod, Dr. Saroj Ghosalia, Dr. Bhumika R, Dr. Annaka Lakshmi Sabu, Dr. Anjana. So with kind permission of our chairs and co-chairs for this session, I would like to request Dr. Nand Kishore to start this session with his presentation. Dr. Nand Kishore, are you there?
Yes, sir. Yes, sir.
Yes.
Am I audible?
Yes. Yes, you are audible. Please share your screen. Yes.
Okay, sir. Sir, can you see?
Yes, your screen is visible. Yes, please put it in on. Yes, sir. In presentation mode, it's there.
Okay, sir. So, good morning to one and all present here. So, myself, Dr. Nand Kishore Iyer, second year PG scholar from the Department of Rasayastra and Bhaishya Kalpana from the College of Alwas Ayurveda Medical College, Mudbidri. And I am hereby presenting my seminar on the topic lifestyle, diet, and yoga for metabolic health. So, to begin with, we all know that Ayurveda views metabolic health as a harmonic functioning of 3 factors, that is Agni, Doshas, and Dhatus. And when these 3 stay balanced, the body maintains stable energy, healthy weight, strong digestion, and balanced hormones. As the slogan goes by, Samadosha Samagnisha, Samadhatu Malakriya, Prasanatmendriya Manaha, Swastha Ityabhidede, quoted by Charaka in his Sutrasthana. And coming to the first one, that is lifestyle. These are some of the daily routine for metabolic health that one can imbibe in his life, like waking up in early, that is Brahma Muhurta around 4:30 or 5, and which helps in calming the hormones and improves digestive rhythm. And as you can see, hydrate with warm water, regular meal timing, that is which will help in preventing insulin fluctuation, stabilizes metabolism also. Regular meal timing should be considered by an individual, and also avoid long gaps or overeating, light dinner before sunset, daily movement, and adequate sleep of minimal of 6.5 hours to 8 hours can be practiced. It is very essential for hormonal balance, appetite control, and tissue repair. And coming to seasonal adjustment, like in Ritucharya, we can see here in summer season, that is Grishma Ritu, we can go for cooling diet, example coconut water, cucumber or ghee, and avoid heavy workout as the bela is very low in that season. And coming to monsoon, we can go for warm, light food, avoid raw or fermented food in excess. And coming into winter, that Shita Ritus, you can go for richer food, deeper exercise as the bela is high, and go for good food, fats to boost Agni. And coming to the second factor, that is diet. Here, Ayurveda considered food as medicine always. So a metabolically supportive diet strengthens Agni, cleans channels, and nourishes cells. These are some of the key dietary principles that anyone can adopt, like eat freshly prepared warm meals, include all 6 tastes in his this one diet, from Madhura to Kashaya in balance, and also reduce heavy, oily, deep fried and cold foods. And always use spices to ignite Agni, like ginger, cumin, coriander are some of the examples. And also choose whole seasonal foods instead of packed or processed item. And for suggested foods for every dosha balance, like for balanced Agni, you can go for moong dal, ghee, lemon, and ginger. For Kapha imbalance, when you are in obesity stage or your weight is gaining so much, you can go for barley, millet, black pepper, and honey. For Pitta imbalance, when acidity or heat is high in the body, you can go for cooling foods, ghee, cucumber, and coconut. These are some of the examples. There are many other examples also. And coming to Vata imbalance, for like in bloating, constipation, you can go for warm soups, sesame oil, and sweet fruits. And eating behavior should be eat only when hungry, stop before you feel full, avoid eating while watching screens, sip warm water during meals, avoid sleeping immediately after eating. And this is very much explained in our classics like Ashtahara Vidhi as well as Ahara Vidhi Vidhana. Ashtahara Vidhi goes by the slogan Gunasta Ahara Drivyana Prakriti Samskriti Kriya Samyogo Desha Kalista Matra Upayoga Samstha Upayokta Chetya Ahara Videhe Vishesha Idhani Ashto. Which is quoted by Ashtanga Hridaya Sutrasthana in the 8th chapter. Like 8 factors are there: Prakriti, Karana, Samyoga, Rashi, Desha, Kala, Upayoga, and Upayokta. Coming to Ahara Vidhi Vidhana, how one should eat the food or meal. You can see Ushna Mashniyat, one should go for warm meals, Snigdha Mashniyat, anxious food, Matravan Ashniyat, Jirne Ashniyat, means one should eat only after the previous meal get digested. Virya Viruddham Ashniyat, na Ishtadeshi, Ishtakali Ashniyat, Nadi Drudam, Nadi Vilambidam Ashniyat. One should not eat very much fast as well as very much slow. Ajalpan, Ahasan, Tadmana Jida. It is also quoted by Charagajara in Sutrasthana. Now we can see the third one, that is yoga. Yoga regulates prana, improves circulation, it tones glands and enhances Agni. So some of the key asanas that one can practice, like Surya Namaskara, it is a complete practice or complete exercise for the whole body. Like it is full body metabolic booster. Trikonasana, Ardha Matsyendrasana, Bhujangasana are some of the examples. And for nervous system stabilization, Vrikshasana is one of the best opted one. Coming to pranayama and meditation, here Kapalabhati, Vastrika, Nadi Shodha, Brahmari, meditation at least of 10 to 15 minutes that one individual can perform, which will help in calming the mind and reducing emotional eating. And coming to discuss, adopting regular yoga practices, wholesome and balanced dietary pattern, lifestyle routine can significantly enhance various aspects of metabolic health, glucose regulation, lipid metabolism, body weight management, and stress reduction. Furthermore, integrating Ayurvedic principles such as individualized dietary recommendations, daily routines, that is dinacharya, and mind-body practices with modern evidence-based lifestyle strategies provide a comprehensive approach in achieving and maintaining long-term metabolic balance and overall well-being. So to conclude with, true health is a continuous journey built through small sustainable habits that nurture the body, calm the mind, and support the long-term well-being, like the building blocks. When lifestyle, diet, and yoga work together, they form a powerful triad that restores balance, enhances vitality, and empowers us to live with clarity, resilience, and inner harmony. So I'm concluding by saying that Edagni Deepto Bhavati Tadeva Swastham Deepyati. Thank you.
Thank you, Dr. Nandkishore. I would request our chairs and co-chairs, if they have any questions, please ask. Savita Madam, Dr. Shiv Kumar Sir.
No,
yes. I have a question for the Scott. Yes.
Yes.
Am I audible?
Yes, madam. Yes,
am I audible, sir?
Yes, madam. Yes, you are audible now. Please, yes. Please ask your questions.
I have a question for the scholar. Am I audible?
Yes, yes.
Yes, you are audible. Please ask.
You are audible. Can you hear us, madam? Hello? You are audible. I think your voice is audible. You can ask your question. I think madam is having some technical issue. Shiv Kumar sir, if you have any question?
No, sir, nothing more for myself. Dr. Nandakishore, is there any supporting papers or previous studies you would have quoted here, na? Like this regarding the diet or yoga? You are told that it modifies the metabolic health. So any supporting studies related data, if you have, you should have presented here.
Okay, sir. Okay.
Yeah, with the lack of this data, it is just a simple presentation on this one basic things like there is no supporting evidence or anything is there.
Okay, sir.
Try to incorporate those things. No?
Sure, sir. Sure, sir.
Okay, sir. So shall we proceed with next presentation, sir?
Yes.
Okay, Dr. Nandakishore, thank you. Thank you so much. Next is Dr. Lakshmi.
Yes, sir.
Dr. Nandakishore, please wait. Dr. Madam wanted to ask question. Dr. Nandakishore, please don't leave, okay? Stay there. Stay there. When Madam returns, she will ask question. Dr. Lakshmi, you can start.
Yes, sir. Good morning, everyone. Myself, Dr. Lakshmi, second year PG scholar, Department of Panchakarma from Dr. T.M. Rural Ayurveda College, Vijaypur, guided by Dr. Prashant Koppa sir and Dr. Anand Pujari sir. My topic is on lifestyle yoga in introduction. Metabolic refers to the biochemical process in the body's normal functioning. It is defined by optimal levels of 5 clinical markers like sugar, electrolytes, high density lipoprotein, cholesterol, blood pressure, age of metabolic health are nutrition, exercise, sleep,
Lakshmi,
stress, and environment. The 5 yes.
Yes, please put it on presentation mode so the entire slide should be visible. Device, which device?
Is it visible, sir?
It is visible, but it is not entire content is visible. Partially it is visible. It is size is very minute. Okay, anyway, you present. Okay, fine.
Okay. Now, sir?
No, now partially it is cutting. Let it be previous version and present this. Yes.
The 5 roots of metabolic health are nutrition, exercise, sleep, stress, and environment. The principles of health are no drugs, regular exercise, adequate rest, positive thinking. Metabolic syndrome is a cluster of
Hello, I think we should proceed with next presentation. Dr. Swarup Rani Sethi. Dr. Lakshmi, please address your technical issue, then you can present your presentation. Not.
yes, sir. Okay.
Dr. Swarup Rani Sethi.
Yes, sir.
Please share your screen. And please make sure your internet connectivity is stable and your video is on. Dr. Lakshmi, please check your internet connection. Then next you can present.
It is a cluster of at least 3 of the following medical conditions: obesity, high serum triglycerides, low high density lipoprotein, and high blood pressure and sugar. Metabolic syndrome has 3 or more measurements: abdominal obesity, waist circumference greater than 30 inches in men, greater than inches in men. Triglyceride level of 150 mg or 150 mg per day or greater. HDL cholesterol of less than 40 mg per dl in men or less than 50 mg dl per dl in women. Systolic blood pressure 130 mm or greater.
Dr. Swarup Rani, please share your screens. Sorry for
Yes,
the disturbance. Yes, she is having some internet issues. Can you hear me, Dr. Swarupa?
Yes, sir.
Yes, please share your screen. Dr. Savita Madam, are you there? You wanted to ask one question. Dr. Nandkishore is there again.
Yes, sir. But
Yes.
I think I lost connection or something happened.
He is still there,
Yeah.
Madam. Nandkishore, if you want.
So Nandakishore, I have a question for Nandakishore. Nandakishore, what is the scientific basis for so many claims that you have made?
Dr. Nandkishore, Madam is asking one question. Please answer.
Hello.
Yes, the scientific basis for all your explanations.
Pardon, ma'am, I didn't got your question.
The scientific explanation for your explanations that you have given.
Scientific explanation, like for the three factors you're asking.
Yes.
It will be based on data right now. So as I didn't presented any of the data, or you need any physiological or like that.
Yes.
Like as we comes into lifestyle or something, as I told, daily routine of for metabolic health, waking up in the Brahma Muhurta will definitely the energy level will be high, and in case of a male, or the testosterone levels will be high. So the activity, the one who is preferring to do more exercises or activity, their energy will be high. So that is considerable. Also, hydrate with warm water means it is very well good for digestion. It will stimulate Agni, and also it will be helpful for detoxing the body. And coming to regular meal timings, it will prevent insulin fluctuation in one's diet. Also, it will stabilize metabolism like that. And going for 6.5 to 8 hours of sleep, it is very essential for hormonal balance. So that's two was for tissue repair. And as I put one GIF in the third slide, like one should not sit and do the duties.
Thank you, Nandakishore. I got your point. Thank you.
Okay, ma'am. Thank you.
Okay, so can we proceed with next presentation, madam? This
Yes, sir. Please.
Dr. Swarup.
Yes, sir.
Yes, please start.
Sir, is my screen visible?
Yes.
Good morning, everyone. My today's topic is Hridaya Shuddhi, Unlocking Atherosclerosis with Lifestyle, Diet and Yoga, a conceptual review. Coming to the introduction, atherosclerosis is a disease in which plaque builds up inside the arteries, which is formed by fat, cholesterol, calcium, and other substances, resulting in hardening and narrowing the arteries over the time. In turn, it hampers the blood supply to the heart and other regions of the body. In Ayurveda, it can be correlated with Dhamani Pratichaya, whose Nidana goes like this. ahara, vihara, like madhura, amla, lavana, guru snigdha bhojana, and vihara like excessive worries, fear, are found maximally as hetu in number of the cases. Samprapti, due to nidana sevana, kha vaigunyata in rasavaha dhamani leads to avadhamedas and kafadhatu vaigunya, kafadosha vaigunya, coming leads to dhamani upalepa, in turn dhamani pratichaya, that we called it atherosclerosis of coronary arteries. Materials and methods. Primary sources, Charak Samhita, Sushruta Samhita, and commentaries like Ayurveda Dipika are sources, and secondary sources like digital source, PubMed, Ayush Research Portal, Google Scholar, modern Ayurvedic books are reviewed. Discussion. Dhamani Pratichaya described under Kafacha Anatmacha Vikara, a condition described as Upalepa that described in Charaka Samhita Sutrasthana 20th chapter, Chakrapani commentaries, or cutting up the internal wall of the Dhamani by excessive medas and Kafadhatu, which in modern correlated as fat or plaque deposition, in turn reason for the Sangha or obstruction in the Dhamani affecting the normal flow of the Vyanavata, which is responsible for the pumping action of the heart that propagates the circulation of the blood in the body. Coming to the role of the lifestyle, that is Dinacharya and Ritucharya, Ayurveda propagates the principle of health preservation, promotion, and disease prevention, along with early diagnosis and holistic disease management strategy, incorporating dietary and lifestyle components under Dinacharya and Ritucharya. Ayurveda routines reveals that it incorporates all the basic life-sustaining practice of the civilized world today, like Brahma Muhurta, Jagarana, Purisha Vega Vidharana, Abhyanga, Vyayama, Sandhya, Devata, Atithya, and Vipra, and Vritti. Coming to the in detail, Nidra. As we all know, Nidraitam Sukha Dukkham, Pushtikasya Valavalam, Vrushata Klivatam, Jnanam Agyanam, Jivitam Nacha. Sleep maintains the circadian rhythm and neuroendocrine rhythm by modulating the balance between serotonin and melatonin, which in turn maintain the homeostasis of the body. Poor sleep quality can affect like increased inflammation and oxidative stress, endothelial dysfunction, and all. So in turn, why people should aim for 7 to 8 hours of sleep per night to support the cardiovascular health. Then Brahma Muhurta Jagarana. As we know, it is 96 minutes before the sunrise. It helps to regulate the circadian rhythm, reducing morning blood pressure, encouraging a morning routine that include physical activity and healthy habits. However, it is essential to maintain a consistent sleep schedule and manage stress level. Coming to the Purisha early morning defecation for proper synchronized system physiology due to Vata-Dosa dominance. Constipation is linked with a risk factor for atherosclerosis, like by mechanism like altered microbiota, reducing toxin buildup and inflammation, lowering blood pressure and cardiovascular stress. Abhyanga, the benefit of Abhyanga goes like Abhyanga Acharet Nityam Sa Jarasrama Vataha, Drushti Prasadam Prustyayu, Sapna Sutak Tadadhikrit. And Vyayama Lagavam Karma Samarthya Diptagni Medashakshaya Vibhakta Ghanaghatratam Vyayamat Upachayate. Oil massage and regular exercise can benefit atherosclerosis by improving circulation and reducing inflammation, by lowering blood pressure and stress level, enhancing lipid profile and glucose metabolism. Then third point, Sandhya and Devata Atithi Vipra Pujana and Vritti. Ayurveda lifestyle of offering options to elder and superior is similar to what modern proverb says, like to be humble to superiors is the duty, to equal courtesy, and to those inferior character, are documented to decrease the risk of disease due to lower level of systemic inflammation. Poor social and personal relation and isolation are found to be associated with increased inflammatory cytokine activity and inflammatory process, and therefore outcome for metabolic health. Coming to the Ritucharya, in Sisira Ritu in classical mentioned like Abhyanga, like example in different type of article, it is proven that Muchida Tilatala Abhyanga in case of atherosclerosis and Abadda Medas like Medarogo, in Ashantarutu, Vamana and Udvartana. And in Grisma Rutu, in Rutucharya, Diva Shita Gruhenita, Nidram, Nishi Chandram Shushitale, like this we can follow. In Vasharutu, Pragharshana Udvartana and Basti, we can adopt it. In Saratrutu, Virechana and Raktamokshana and Virechana like Vidyangatandulya Yoga that already proven in different type of article. Role of diet and yoga. The famous quoted that Pathe Sati Gadadashyam Kimosadham Nishevanat. Pathe Sati Gadadashyam Kimosadham Nishevanat. A balanced diet can help to lower the LDL cholesterol level and triglyceride, reduce inflammation and oxidative stress, and support overall the cardiovascular health. So focusing on the nutrient-dense food like fruits, vegetable, whole grain, lean protein, healthy fats, like in Ayurveda has mentioned Shashtika, Shalyamudka, Saindhava, Amalaka, Yavan, like this, including Rashuna, turmeric, ginger, ghee, greeny leafy vegetables, and in drugs like Arjuna, Triphala, Gugulu for lipid control and heart toning. Limit the processed food, high sugar and high sodium foods can prevent atherosclerosis. Yogic posture like improving circulation like Tadasana, Trikonasana, Bhujangasana, Ardha Mashendriyasana, Pranayama like Anuloma Biloma, improve insulin sensitivity. These in turn improve the insulin sensitivity. Yoga can help to regulate the blood sugar level and improve the insulin sensitivity by reducing the risk of developing metabolic syndrome and type 2 diabetes, both of which are risk factor for the atherosclerosis. The last conclusion, Hriday Shuddhi provide a holistic framework for heart health, lifestyle modification, balanced diet and yoga can unlock natural healing from atherosclerosis. Future research scope, lifestyle modification for atherosclerosis management, examine the impact of stress management, sleep optimization, and physical activity on atherosclerosis progression. Unique research process like gut microbiome modulation in atherosclerosis, investigate the role of gut microbiota in atherosclerosis development and the impact in dietary and lifestyle intervention, yoga and epigenetic modification in atherosclerosis. Therefore, by synergizing ancient and wisdom with modern science, we can reclaim heart health and redefine the narrative of atherosclerosis. Thank you.
Thank you, Dr. Swaroop. Madam, any question from your side? Dr. Savita, madam, do you have any question?
Do not have any questions, sir.
Okay.
Yeah, Swarupa, whatever you told just seems like a philosophy. Do we have any data, for example, trials on Brahma Muhurta? How many trials have been conducted on Brahma Muhurta and what are the effect of waking up early in the morning? Have you done such thing? Have you tried to find out such studies?
No, sir. I just reviewed from this topic from article, not true.
That is what it looks just like a philosophy. So whenever you present your any paper in some presentation and seminars and all, so you should come with the proper data. Okay. For example, you can try to establish a relationship between waking up early in the morning and what were the BMIs, what are the weight changes, what are the cognitive changes, and then relate it with metabolic syndrome and all. Right?
Oh, okay, sir.
That's from my side.
Okay, sir. Thank you.
Okay, sir. Thank you, sir. Ramana, sir.
Dr. Swarupa, your topic is having the Hridaya Shuddhi, the word. So what it implies, is it at physical level or spiritual level? You should have highlighted it. Like there are two aspects. One is physical health and the mental health. So both aspects you have to justify.
So this is for both the aspect. Like in classic, there is not mention of like this term Hridaya Shuddhi. In Yoga Sastra, Shuddhi is like Nitya, Naimitika, Atyantika. In three types, Hridaya Shuddhi can be correlated, sir. Both like if you take from yogic shastra, like Anahata Chakra is the sthana is seated inside the hridaya, so it can be correlated with as per the yogic shastra. Then as per the Ayurvedic, like Mahamarma, Hridaya, Vasti and Shira, we can correlate it with that also.
Okay, you should have mentioned some studies which if they have conducted on this particular aspect, because yoga, plenty of research is there. So some yogic researchers, especially in this aspect, like related to atherosclerosis, it should have been mentioned. Then it would have been a better paper.
Okay, sir.
Like, that's all.
So, okay. Thank you, Dr. Swarupa. Next is Dr. Priyanka. Dr. Priyanka Rathod. Dr. Priyanka Rathod, are you there? Dr. Swarupa, please stop your screen from sharing.
Am I audible, sir?
Yes, sir. Dr. Priyanka, please share your screen now.
Sir, is it visible?
Not yet. Not visible. You try it again.
Yes, sir.
You want some time? Dr. Priyanka, do you need some time?
Sir, may I get some time, sir?
No problem, no problem. Take your time. Dr. Snehal Kurle. Are you there, Dr. Snehal?
Yes, sir, I'm there.
You
Sir,
can
I'm
say.
presenting in my friend laptop only
No problem.
because we are from same college.
Yeah, no problem. Please turn on your video. While presenting, please keep your video on.
Okay, sir.
And try to complete it within 5+1 minutes, okay?
Okay, sir. Not working. Wait, it's not coming, sir. Good morning, everyone. Myself, Dr. Snehal Kurli, second year PG scholar, Department of Yoga Nidana from JNC Bengaluru. Introduction. These are the objectives we will come across, that understanding of the metabolic health with integral approach considering Ayurvedic and modern perspective. Understanding the Agni as the core of metabolism, Ama as the root for the causing the metabolic disorders. Learn of the role of the lifestyles and diet and yoga in maintaining the metabolic health. This is not visible. Metabolic health refers to the optimal functioning of the body's metabolic process, including the conversion of the food into the energy and the management of the cholesterol and fat and the blood sugar regulation. In terms of Ayurveda, metabolism is not just a biochemical process, it is a system governed by the balancing of the Agni, Dosha, Dhatu Poshana and the Ojas. Next is Sir, is it visible? Agni is the core of metabolism, like in that Jataragni, Bhutagni, and Tatvagni. Jataragni responsible for breaking down the food and the transforming it into the energy, ensures the proper digestion, absorption, and assimilation. If impaired, lead to the Ama production, causing the sluggish metabolism. Bhutagni convert the complex food molecule into the 5 elemental component, that is Panchamahabhutas. Dhatvagni, each Dhatu has their own Dhatvagni, regulate the tissue specific metabolism, maintaining the proper growth and the repair organ and the system. Then modern correlation. How can we correlate this Agni into modern contemporary sciences like
Jataragni, that is digestive fire. We can compare to the digestive enzyme secretions, gut microbial activity, that gut brain axis, everything it will come in the Jataragni. Bhutagni is the fire, it is fire elemental fire that is can be compared to the conversion of the macronutrient into the bioavailable micronutrient, that is for example carbohydrate that is getting metabolized in the liver, it is converting into the glucose formation, protein in the liver it is converting into the amino acids. Dhatu Agni, that is tissue metabolism and nourishment, that we can compare to the cellular respiration and the ATP production. AMA, when you come to that, AMA is a root cause of all the metabolic disorders. Inefficient functioning of the Agni lead to the improper digestion and result in the formation of the AMA, which obstruct the channel and disturb the energy production. Signs of AMA accumulation and disease linked into how can we correlate, how can we understand in the contemporary science, like symptoms which have been explained in the classics like sluggish metabolism, bloating, fatigue, unexplained weight gain, loss, joint pain, skin disorders, all how can we in metabolic syndromes, it's like metabolic disorders like metabolic syndrome, fatty liver, autoimmune conditions, PCOS, hypertension, diabetes mellitus. Role of lifestyle, that is how we can come across like dinacharya, rutucharya and Ratricharya. In that Dinacharya, maintain the circadian rhythm by the aligning the daily activity with the body's natural biological clock, balancing the doshas, regulate the digestion and promote the mental and the physical well-being. Practice include the routine activities like the Vyayama, Abhyanga, Ahara. And the Ritucharya, it include the seasonal recommendation of the Ahara and the Vihara, immunity enhancing like Vyadik Shamatva, regulating Agni and the balancing dosha, preventing the lifestyle disorders. Ratricharya is the Ayurvedic night regimen that maintain the health by promoting the rest, the sleep, and the proper digestion through the set of daily practices. It includes the light activity, head massage, sleep hygiene. Role of yoga. Yoga and the pranayama play the significant role in the stress management and the hormonal balance, regulating the metabolism rate and the hormonal secretions. Like asanas like Surya Namaskara, Trikonasana, Dhanurasana improve the metabolism. Pranayama is like Kapalbhati, Bastrika, this will help in the oxygenation. Meditation reduces the stress, induce metabolic imbalance, and they improve the insulin sensitivity. Balancing Agni, Dosha, Dhatu, Ojas for the metabolic health, lifestyle, diet, and yoga are core of intervention. Metabolic health is similar equilibrium with the harmony of Agni, Dosha, Dhatu, and the Ojas, that is Samadosha, Samagni, Samadhatu, Malakriyaha. Ayurveda offer the timeless guidelines through the Ahara, Vihara, and the yoga. Quote to conclude that health and disease arises from the balance and the imbalance. Thank you, sir.
Dr. Snehal, I have something to say. Am I
Yes, sir.
audible?
Yes, ma'am. Yes, ma'am.
Dr. Snehal, your title and the content do not match.
It's regarding the yoga, ma'am.
Nothing. There is not even a single slide. I mean, your content and your title do not match. And I think for a postgraduate scholar, you have to be much more clear with your this thing. I
Okay,
think that
ma'am.
is where you lack.
Okay,
Thank
ma'am. I
you.
will improve. Thank you, ma'am.
Snehal, in the last slide you mentioned about asana and oxygenization. What is that?
So, like we have come across like reduced stress and the balancing hormone when you sympathetic overactivity and parasympathetic dominance, like when you go to the more of stress like cortisol and the adrenaline, that will lower the when it is asanas will lower the blood glucose and the abdominal that is abdominal obesity and inflammation. Like pranayama, yoga and the meditation will help in the balancing the hormones, sir, mainly that is
No,
reducing the stress.
I was interested in the term oxygenization.
That is nothing but the mode of inspiration and expiration, how that is acting on the HP axis, sir. I think
Okay, nothing to do with oxygen.
sir, HP axis how it is act that
asanas like pranayama, meditation, etc.
That I
sir.
understood. Nothing to do with oxygen, right?
Okay, okay, sir.
No, it has, this word has nothing to do with oxygen. Okay, okay, thank you.
Ramana sir?
Yes, yes. The presenter should have been put more effort in compiling certain evidences, because it is just a theoretical accumulation what she presented. But this is in this platform, I think it is not up to the mark, this particular presentation. At least something innovative should have been presented, sir. That's all.
Yes, please, I request to all presenter, please make a note of it, the suggestions provided by learned resource persons. Please try to include some data in presentation. At least you should have some scientific basis, whatever you are presenting. Okay, sir. Shall we move to next presentation? Dr. Manjunath.
Yes, sir. I'm there, sir. Hello, sir. Am I audible, sir?
Yes, yes. You're audible. Please put your screen in presentation mode and then start.
Yes.
I think your screen has stopped sharing.
Sir, are my slides visible, sir?
Yes, yes, it's visible. Yes, it is visible. Please.
Yes. Yes, sir. I'll start. Good morning, everyone. Myself, Dr. Manjunath Wali, presenting on the topic Kayika Karma, a boon in Sthaulya obesity. Introduction. Medo Mamsa Ativradha Tattva Chala Spik Gudastanaha Ayatopacha Utsaho Naro Atistulha Uchate. Charak Sutra 21st chapter 9th sloka. Purpose to highlight the importance of Kayika Karma in the management of Sthaulya. Vyayama Nityo Jirnashi Yavagoduma Bhojanehi Santarpana Krita Dosh स्थौल्य मुक्त्वा विमुच्यते चिकित्सा संप्राप्ति विघटनं चिकित्सा अतः तस्य उत्पत्ति हेतुं परिहरेत् निग्रह हेतव संशमन संशोधन आहार आचार कायिक कर्म उत्क्षेपण अवक्षेपणादि व्यायाम प्रयोजन it increases the lagam karma samartham dipto agni melsakshay stiropachita mamsa vivakta ghana ghatratvam and decrease javaparoda guru gatrata chalaspik udarastata daurbalyam आरोग्यम चापि परमं व्यायामम् उपजायते न चास्ति सदृशं तेन किंचित् स्थौल्यापकर्षणं सुश्रुत चिकित्सा 7th chapter 32nd to 33rd shloka. Probable mode of action of Kayika Karma, that is the Viparita Guna action will be there, that is Lagu, Guru, Ruksha, Snigdha, Chala, Stira, Manda, Ushna, Shita, and also it has been mentioned in the types of Niragni Sweda, that is Vyayam, Ushma Sadhana, Guru Pravarnam, Kshuda, Bahupanam, Bhayakroda, Upanaha, Atapaha, Swedanti, Darshanai, Naramagni, Analudrate, Stula, Guru, Kafa Medasa, Kayika Karma, Lagu, Ruksha, Chala, Kapara, Medohara, Swasta, Laguta Karma Samartham. These are aerobic versus anaerobic training. Types of aerobic include requires the presence of oxygen, primarily works on type 1 muscle fibers, increases muscle endurance and capillary size, heart muscle to pump blood more efficiently, sustain for an extended period of time, heart rate between 120 to 1 beats per minute. Anaerobic activity does not require presence of oxygen. It works the type 2 muscle fibers, which leads to greater size and strength of muscles. Oxygen builds up, lactic acids build up, and you start to feel the burn. You can't sustain this kind of activity for extended type of time. Sthaulya, being one of the major concern worldwide, is responsible for increase. It is necessary to address its initial stages itself. Kayika Karma, which includes variety of activities in increasing intensity like Chankramana, Vyayama, Niyudha, Pratarana, etc., done by observing Desha, Kala, Bala, Asana will help to Apachita Medas, and Mamsa duties, Agneya, like property and Vata. Success is about working hard consistently. Thank you.
Thank you, Dr. Manjunath. Madam, Savita Madam.
Yes, Dr. Manjunath. Yes, sir. Dr.
Yes,
Manjunath,
sir.
please
Yes, ma'am.
define Kaika Karma.
What, ma'am?
Please define Kaika Karma. Am I audible?
Yes, yes, you are audible.
Yes, please define Kaika Karma.
Hello, ma'am.
Yeah.
Kayavanga Manasam, Karma, Shubha Shubha Bhayatmakam. Shubha Shubham, Abhayatmakam.
Yeah, please explain also, na?
Kayavang Manasam, Karma, Shubha Abhayatmakam. Hello,
Yeah,
ma'am.
yeah, please explain.
Kayika Karma means active body or physical actions, ma'am. It refers to all physical actions, movements, exercise actions, and behavior carried out the body. Physical activities like walking, exercising, postures, dinacharya, and any action involving sharira. And in
Actually,
Ayurveda, yes, ma'am.
I was expecting really good paper from your side, but you have missed yoga. You have missed so many other activities that are Kaika. I think next time when you present, please make sure to do a lot of literature research and get back.
Yes, ma'am. Sure, ma'am. Thank you, ma'am. I will include it.
Sir.
Yes.
Kumar, sir.
Nothing from my side. The same comments as that of Dr. Savita.
Nothing more to add from my side also.
Okay, sir. So we shall move to next presentation, sir.
Okay, sir. Thank you.
Thank you, Dr. Manjunath.
Yes.
Dr. Kiran. Dr. Kiran Eli.
Yes, sir.
Please share your screen, Dr. Kiran. And please try to conclude your presentation within 5 plus 1 minute.
Okay, sir. Sir, my screen is visible?
Visible, please.
Sir?
Yes, it is visible. Please go ahead. Yes.
Hello, everyone. My name is Dr. Kiran, PG scholar, Sastricta department from Sumatibai Shah Ayurved Mahavidyalaya, Pune, Maharashtra. My title name is Mindfulness and Metabolism, the role of meditation in reducing stress hormone and improving the metabolic marker. I present a focused narrative review linking stress physiology and metabolic health with how mindfulness helps. Let's start with Sir, my screen is visible?
Background and rationale, yes, please.
Yes. Let's start with background. For understanding the importance of mindfulness with high stress prevalence in modern society, lifestyle disorders are on the rise. Chronic stress disturbs the emotional regulation, leading to anxiety and depression, which further complicates metabolic health. Mindfulness meditation offers an evidence-based approach to effectively manage stress and enhance the overall health. Here aims and objective. This study aims to review role of mindfulness meditation on stress level to assess the impact on key metabolic markers, that is glycemic control, lipid profile, and inflammation. Objective of this study is to promote mindfulness meditation on metabolic markers, to explore the highlight of interconnection of mental and physical health. Here is the stress mechanism. Stress activates the hypothalamic pituitary adrenal axis, that is HPA axis, leading to increase in cortisol production, which can disturb the normal physiological function and overall well-being. Prolonged elevated cortisol converts the glycogen into glucose, which leads to hyperglycemia, which is risk factor to type 2 diabetes. Then on a lipid profile, elevated cortisol dysregulates the function of cholesterol, which is high risk for cardiovascular diseases. Then also elevated cortisol effect on the increasing craving dense calories food, which leads to obesity. Here is the mindfulness mechanism. Mindfulness meditation activates the parasympathetic nervous system, promoting the relaxation and reducing physiological stress response. Regular meditation practice leads to reduction in cortisol level and enhance the overall health. Metabolic benefits of mindful meditation. Previously, we see the cortisol reduction due to meditation, which enhance the glycemic control regulation, contributes to stabilize blood glucose level, and enhance the insulin sensitivity, which reduce the risk of type 2 diabetes. In lipid profile, regular practice contributes to healthier lipid profile, which improve the cardiovascular health. And important benefit is that reduction in inflammation by meditation, which regulates the pro-inflammatory genes, which reduce the circulatory markers. Here is the diagrammatic presentation of metabolic benefits. That meditation benefit the healthy sleep, which improve the brain activity, maintain hormonal balance, also improve the cardiovascular health, gut improvement, better immune response. Here is the Ayurvedic perspective for understanding the integration of mindfulness and Ayurvedic principle for holistic health to promote the harmony among the three doshas, leading to improve overall health. Anti-inflammatory effect reduce the harm, that is metabolic toxic. Also enhancing the Agni, which improve metabolism and also increase the nutrient absorption, which is critical for maintaining energy level. And most important part is mind-body connection, that is Sattva. Through its calming effect, meditation support emotional balance and mental clarity, align with the link between calmness, that is Manas Shanti, and a healthy body, that is Sharir. Here is the conclusion and future scope. Conclusion of this study that mindfulness meditation is an evidence-based protocol that addresses the stress-induced causing dysfunction. It offers a holistic non-pharmacological strategy for managing the metabolic health, breathing ancient and with contemporary medical science. Future recommendation is that implement the short daily mindfulness for 10 to 15 minutes and integrate the structure mindfulness training into daily routine. Also, we can conduct the clinical trial on the basis of cortisol glucose lipid markers on biochemical view. Here are the references. Thanking to all these reviewing me for this paper, and thanks to listening me.
Thank you, Dr. Kiran. Madam, Savita madam.
Sir, Dr. Kiran, you mentioned about biomarkers.
Yes,
And
ma'am.
metabolic markers, we did not find any metabolic markers mentioned in your presentation. And again, as usual, like previous callers, you also lack the data. I think next presentations you have to properly give away data. Otherwise, it is just a collection. That's it. Thank you.
Okay, thank you, ma'am.
Yeah.
Can you highlight the techniques which are adopted for mindfulness? What techniques can be adopted?
Yes. What, sir?
What are the techniques you adopt for mindfulness to achieve the mindfulness?
Here we just mentioned the pathophysiology about mindfulness on markers. We just techniques, I think we can include in scope of this study.
No, sir is asking what is the protocol of mindfulness?
Basically, mindfulness is a regular meditation resulting ability. That protocol is a daily basis meditation about 10 to 15 minutes up to 6 to 8 weeks. So this is from article I reference here, that clinical trial on meditation.
So you are not doing any mindfulness protocol.
No, here I not included any protocol.
नहीं, मैं ये कह रहा था कि आप माइंडफुलनेस प्रोटोकॉल करवाते हैं किसी पेशेंट पे या कहीं से उठाया इसको?
नहीं सर, कॉलेज में तो करवाते हैं ना।
माइंडफुलनेस करवाते हैं ना, तो उसमें क्या क्या करवाते हैं आप माइंडफुलनेस में?
It's just focusing on breathe and most importantly that include 10 minutes om chanting.
तो हम लोग वही पूछ रहे थे कि आप माइंडफुलनेस प्रोटोकॉल होगा ना कोई, आप तो रोज क्या करवाते हैं? मंत्र से स्टार्ट होगा, 15 मिनट मेडिटेशन होगा, फिर उसके बाद
Yeah, sorry. Okay. I'm sorry. Mindfulness is that 10 to 15 minutes om chanting and then for 5 to 10 minutes focus on breathe.
Yeah, it should include that all kaika, vachika, manasika, all those aspects the mindfulness is required, isn't it? Only not for focusing only on the mind, is it sufficient to prevent this the stress hormones, to regulate the stress hormones? And in all aspects it is required, isn't it?
Yes, sir, not completely, but it can help to reduce some side effects.
Okay.
Sir, am I audible?
Yes,
You are
yes.
audible.
You want to add more, Dr. Kiran?
No,
That's
nothing
all.
from that. Thank
you. Okay. Okay, thank you, Dr. Kiran.
Thank you, sir.
Thank you for the presentation. Okay. We shall proceed with next presentation. Dr. Mahima Rathod. Dr. Mahima, are you there? Dr. Priyanka Rathod, are you ready?
Yes, sir. Am I audible, sir?
Yes. Still you're facing issue?
No, sir, I will share. Sir, can I share my PDF, sir?
Yeah, PDF, but preferably it should be in PPT mode. But anyhow.
PPT is not, I'm not able to share the PPT, sir.
Okay, anyway, no problem.
Okay. Myself, Dr. Priyanka, second year PG scholar, Department of Dravya Guna from Government Ayurveda Medical College, Bangalore. And my topic for the presentation is integration of lifestyle, diet, and yoga for maintaining metabolic health based on Ayurveda. The list of contents includes introduction, Nidana and Samprapti, lifestyle, diet, and yoga discussion part, and the conclusion. Introduction. Metabolic health is not only the absence of the metabolic disorder, it is also the proper functioning of digestion, metabolism, and energy transformation, which are governed by Agni. In today's fast-paced world, sedentary habits, irregular eating patterns, stressful lifestyle, and poor sleep have contributed to a rising burden of metabolic disorder. The prevalence rate of metabolic disorder is increasing every year. It is estimated that nearly 1/4 of the global adult population exhibits metabolic syndrome, and at a doubled risk of mortality and tripled risk of heart attack or stroke, and a likelihood of developing type 2 diabetes mellitus. According to one WHO region-based review, about 20 to 25% of adults worldwide have metabolic syndrome, where India stands second position in worldwide incidence of diabetes. A person with good metabolic health has normal blood sugar levels, balanced cholesterol, and triglyceride without any medications. Nidana and Samprapti includes Avyayama and intake of Madhura, Guru, Snigdha, Bhojana, Adhyashana, Divaswapna, and other kapha aggravating factors. Due to the above said Nidanas, Agni becomes weak, kapha dosha and Medha Dhatu gets aggravated and obstructs the passage of Rasavaha and Medhavaha Srotas, which restricts the movement of the Vata, leading to Dhatu Dushti. It leads to the further formation of metabolic disorders. And discussion about the lifestyle, diet, and yoga. Incorporating the lifestyle practices like Dinacharya, Ritucharya, wholesome dietary habits, and yogic disciplines enhances digestive fire, improves insulin sensitivity, regulates body weight, reduces inflammation, supports mental clarity, and strengthens the overall vitality. Among the lifestyle, it includes Nidra, Vihara, Shodhana, etc. Nidra, right amount of sleep helps in maintaining the good health, long life, strength, etc. Vihara includes the Vyayama, Udvarthana, Snana, Seka, Lepa, etc. And in Shodhana, it plays a central role in preserving and restoring the metabolic health, and it helps in kindles the Agni, removes the obstruction in the Srotas, balances the doshas, rejuvenates the tissues, improves the functions of the organs, and stabilizes the hormone. And diet, a balanced diet helps to maintain the required amount of carbohydrates, fat, amino acids, vitamins, minerals, which includes Ruksha, Yava, Udana, Vatya, Saktu, and some other preparations like apupa mixed with the palatable meat soup, Purana Shali cooked with the Mudga Yushadi and Tikta Shakas, Madhu, Mudga, Grita, Kshira, Shunti, Trifala, Yava, and the cooked food should be freshly prepared and it should be warm. And what should not be taken to maintain healthy life is also as important as what should not be taken, and it includes excessive madhura ahara, heavy oily junk foods, white rice, refined wheat, bakery items, sedentary snacking, fast food, and cold drinks, etc. And yoga, it comes under the Adravya Bhuta Chikitsa or Bahir Parimarjana Chikitsa, and it includes Surya Namaskara, Trikonasana, Parshvakonasana, etc. And the Surya Namaskara, it is the most effective for improving overall metabolism, enhances cardiovascular fitness and weight management. And other asanas also stimulates the abdominal organs, strengthens the core, enhances pancreatic function, optimizes the glucose metabolism, supports digestion, regulates fat storage, reduces the stress. And the pranayama, which includes the Kapalabhati, Bhastrika, Anulomana, Vilomana, Ujjayi pranayama. The Kapalabhati strongly influences abdominal fat metabolism, stimulates the pancreas, and improves glucose regulation. Bhastrika boosts the basal metabolic rate, improves the oxygenation and energy utilization. Anulomana Vilomana balances autonomic nervous system, excellent for hypertension, stress-induced metabolic disorders. Ujjayi pranayama, it enhances the thyroid function, helps in appetite, stress, and metabolic balance. And meditation or yoga nidra reduces the cortisol levels, highly effective in reducing the stress-driven metabolic disorders, and improves sleep. Discussion and conclusion. Ayurveda emphasizes that health is equilibrium state of the dosha, Agni, Dhatu, and Mala, along with the cheerful spirit, Indriyas, and peaceful mind. To maintain the healthy metabolic state of the body, it is essential to follow the healthy lifestyle, food habits, and physical activity, along with stress-free mind. Following the fundamental principles of Ayurveda like Dinacharya, Ritucharya, etc., helps in maintaining the metabolic health. Consuming the excessive guru snigdha madhura ahara should be avoided, as nidana parimarjana also plays a major role in maintaining the metabolic health. And ardha shaktya vyayama should be done as mentioned in the classics, or it may further lead to the vata prakopa and other vyadhi may occur. Daily practice of the yoga helps in stimulating the internal organs and stimulates the cells, stabilizes hormone, keeps the mind calm, and reduces the stress. Along with all this, it is more essential to have a balanced Agni. Conclusion: to maintain good metabolic health, along with the proper ahara and aushadhi, one has to practice the basic principles mentioned in Ayurveda like Dinacharya, Ritucharya, Ratricharya, Rutushodhana, etc. And integrating these Ayurvedic principles with modern scientific understanding, including the public health awareness, provides a comprehensive and preventive approach to maintain management of the metabolic health. As it is difficult to treat the metabolic disorders, it is better to prevent by avoiding the causative factors. Thank you.
Thank you, Dr. Priyanka. Madam?
Yeah, I don't have any questions. A good presentation.
Okay. Sir?
Thank you.
Yeah, yes, sir. Yes, sir.
Yeah, please tell Bharti.
Please, as usual, sir, the presentation lacked some references, whatever they claim. So I think those should be included in your next presentation.
Yes.
At least an effort should have been done just to document, like to present what are the effects of Rutu Shodhana on the metabolic health. So some studies are already there. At least that should have been incorporated in certain procedures. What effects are there on the metabolic health parameters? That effort is not done. It is simply a accumulation of these theoretical facts. That's all. Theoretical.
Okay, sir.
Okay, Dr. Priyanka, please note the suggestions made by the experts and please consider those suggestions for your next presentation. Okay.
Yes, sir. Yes.
Try to provide it. Okay. Thank you. Thank you for your time. Dr. Mahima. Dr. Mahima is there? Dr. Mahima Rathod. Dr. Saroj Gosalia. Dr. Bhumika.
Yes, sir, I'm there, sir.
Yes, please. Bhumika, are you able to share your screen?
Sir, I'm trying, sir. Sir, is my screen visible, sir?
No, not yet. Okay, you take your time, fix it. We'll call
Sir, I'm sharing, sir. I'm sharing. Is it visible, sir, now?
No, sorry.
Oh, it's not.
Okay, sir, just give me a second, sir. I'll rewrite.
Dr. Anaga Lakshmi. Dr. Anaga Lakshmi. Dr. Anjana.
Yes, sir.
Dr. Anjana P.
Yes, sir.
Yes, please share your screen. You can present.
Yes.
Should take. Yes.
Is it visible, sir?
Yes, it's visible. Please put it in presentation mode. Yes. You can
So shall I
start.
start?
Yeah, please.
Yeah. A warm good afternoon to one and all present here. I'm Dr. Anjana, second year PG scholar, Department of Rajana Sharira, GMC, Bengaluru. I will be presenting on topic Yoga for Metabolic Health with reference to PCOS. Objective: understand PCOS from Ayurvedic and modern viewpoint. Role of yoga in improving metabolic health in PCOS. To evaluate how Dhanurasana influence pelvic and abdominal organ function. To analyze the physiological impact of Dhanurasana on hormonal balance and metabolism.
ಆಯ್ತು 10 ನಿಮಿಷ ಅಷ್ಟೇ ಲಾಸ್ಟ್ ಪ್ರೆಸೆಂಟೇಷನ್
Sir,
Yes, please proceed. No problem.
Polycystic ovarian syndrome. It is a heterogeneous condition characterized by menstrual abnormalities, hyperandrogenism, obesity, and polycystic ovaries. So the prevalence is 6 to 10% globally, and it accounts for 20% secondary amenorrhea and 50% oligoovulation and menstrual irregularities. So the PCOS symptoms: mainly the missing period, excess body hair, chronic acne, hair loss, and missing periods, and also the inability to conceive and insomnia. The exact etiopathogenesis is unknown, and the main causes include insulin resistance, stress, genetic, hormonal imbalance, lifestyle. So here you can see the stress and lifestyle, that is the sedentary lifestyle, play an important role in manifesting PCOS. In Ayurveda, we can't see a direct correlation, but observing the symptoms, we can correlate with the Nashtartava, Bandhitva, Kafaja Grandhi, and Stauria, so on. Due to Nidana Sevana, it leads to Agni Mandya and Ama formation, leads to Kapha Vriddhi and Vada Vaigunya, and Atavaha Srodho Avarodha, leads to menstrual abnormalities, and also Ubajaya of Medas and Meda Vriddhi. So will yoga help? Here you can see some asanas, that is Padmasana, Dhanurasana, Sarvangasana, Paschimottasana, Baddhakonasana, Surya Namaskara. All these asana play an important role in managing PCOS. How they will help? By stimulating the reproductive organ, relieving stress, weight loss, and regulating the endocrine gland. So in this paper, I am concentrating on the Dhanurasana, the role of Dhanurasana in PCOS. Why I had chosen this Dhanurasana? Because it helps in both the way, that is the metabolic and the endocrine regulation. So the bow pose or Dhanurasana involves lying on prone position, bending your knee, grabbing your ankles, and lifting your chest and thigh off the floor to resemble a bow. So what are the anatomical changes happening? First is the muscle gets stretched and strengthened. So muscle gets stretched are the chest muscle, mainly the pectoralis major muscle, abdominal muscle, hip flexors, that is iliopsoas muscle, chest muscle, and the sternocleidomastoid, deltoid, and also the entire spine is extending. And the muscle gets strengthened are the back extensor, gluteal muscle, hamstring muscle, and shoulder and arm. So by the stretching of this muscle, it improves the blood flow to the pelvic and the abdominal region, so that the pelvic organs get stimulated, and the gentle compression of the abdomen, it stimulates the gently massage the pancreas, liver, and digestive organ. The next is the physiological changes. The Agni, Dosha, and Srodhas are the basic components, and the Agni here the Mandagni, and the Dosha Vada, Pitta, and Kapha, 3 doshas. Mainly the normally in Kapha, which helps in development of follicle, and Vada for proper outcome of menstrual cycle, and Pitta is for hormonal activity and ovulation. But in this condition, that Kapha get vitiated, so there no proper development of follicle, and the Vada, that is mainly the Apana Vada, get obstructed. The movement of Apana Vada get obstructed, and the Pitta function gets suppressed by Vada and Kapha. So by practicing the Dhanurasana, it leads to Agni Deepti, Amapachana, and Kapha Vada Shamana, mainly the Srodho Vishodhana, so that ultimately there will be Apana Vada Anulomana. So next is the how metabolic regulation. So metabolic regulation mainly happen because of the increased blood circulation, enhance the cellular metabolism, and also because of the abdominal compression, it gently massages the pancreas, liver, and digestive organ, enhance the glucose and fat metabolism. Next is the stress reduction. So holding Dhanurasana with slow and steady breathing, it shifts control from the sympathetic to parasympathetic. Sympathetic activity, that is mainly vagal activity increase, and the heart rate slows, and the muscle tension decreases. and also it helps to lowering the cortisol level and release of endorphin. That is generally physical activity increase the release of the endorphin, serotonin, and the dopamine. It creates a calmness, pleasure, and emotional balance. Next is the endocrine balance. By the regulation of the autonomic nervous system, improved blood circulation to the endocrine gland, and harmonizing the HPO axis. Here you can see that in that asana, this asana, the neck and spine extension, which stimulate the hypothalamus and pituitary. These are the master glands which controls the entire endocrine system. And also the reduced cortisol level, it restores the GnRS system and also improves pelvic blood flow that nourishes the ovaries, uterus, everything, and also enhance the insulin sensitivity and balance of sympathetic and parasympathetic system. So these are the changes happening while practicing the Dhanurasana. So conclusion, PCOS is a multifactorial disorder involving metabolic, hormonal, and psychological imbalance. Practice of Dhanurasana pacify Vata and Kapha, enhance acne, clears Rodha, and function of Atavaha Srodhas. It helps to regulate metabolism, improve circulation to pelvic organ, enhance the function of endocrine glands. Hence, regular practice of Dhanurasana serve as an effective non-pharmacological, improving the metabolic health and restoring reproductive balance in PCOS. Along with lifestyle modification and medication, yoga play an important role in PCOS. Thank you.
Good effort, Dr. Anjana. But again, there is a difference in between your title and the content. Rather, you could have just focused upon only Dhanurasana, and that would have really helped us in assessment. Because you have used terms like yoga very vaguely, and somewhere you have come down to asana. But it was a good effort. Next time, make sure to stick on to the title and the time period. Just fix the time period and do work upon it.
Yes, ma'am. Sure, ma'am.
Madam, is there any particular reason that only Dhanurasana is focused? There are certain other asanas are also there, like Ardhamasyandrasana is there.
Yes, sir. Padmasana is there. Baddha Konasana is there.
Yeah, so why only Dhanurasana? Is it sufficient to regulate this particular ailment? Like
actually, sir, no such research work has done, sir. Only focusing on single asana. All I had referred all the articles. All of them are used many asanas like Baddha Konasana, Padmasana, and all. So I thought I will concentrate on one so that it will, for further research and all, it will be helpful.
have you did any like trial, like any 1 or 2 cases, like anything have you done?
No, sir. No,
Your
sir.
observation, you are not done.
No, sir.
Yeah, because that is the important, now that how much
Yes.
duration we have to do, how many times in a day we have to do, is it sufficient alone? Is it? You are claiming that PCOS it is helpful, but is it only with the Dhanurasana? Is it possible? Please think over it.
Yes, sir. Clinical trials are needed, sir. Yes.
Okay. Thank you, Dr. Anjana. Next is Dr. Amulya. Dr. Amulya. Dr. Amulya, are you there?
Hello. Am I audible, sir?
Yes, yes.
Okay. Let me share my screen. One second.
Yeah, please share your screen.
Whether my screen is visible, sir?
Yes, yes.
Okay.
So with kind, one minute, Amulya. With kind permission of respected chairs and co-chairs, we are taking this presentation from previous session. So please allow us. She couldn't complete in previous session. Okay, Dr. Amulya.
Okay, sir. I hope I'm audible and my screen is visible, sir. Just
Yes.
confirming one more time.
Yes, yes.
Okay, okay. Very good morning to one and all. Um, Namaste everyone, all the dignitaries, all the judges. I'm Dr. Amulya Murthy, PhD scholar from the Department of Swasthita and Yoga in NIA Jaipur. Today I'll be presenting a case that demonstrates how correcting Nidra alone triggered powerful improvements in gut health, inflammation, metabolism, and ultimately obesity. This case shows why Nidra is not just supportive, but central in metabolic management. So when we look into Nidra, Nidra is described as a fundamental pillar of health in Ayurveda. Both Ayurveda and modern research agree that poor sleep disrupts circadian rhythm, increases cortisol, alters appetite hormones, and promotes late night eating and whatnot. So this is a case presentation that I'll be presenting. So the patient is 43 years old female. She's a corporate professional, and she came with the complaints that she's, all the time fatigued. She also had mild lipidemia and weight gain from last 4 years. And initially, when we checked her gut microbiota, they were elevated firmicutes and all these. There was a disturbance in the ratio, and the inflammatory markers were also very high. So initial Ayurvedic regimen that we given her for 8 weeks, that did not give us those results that we were expecting, and which were seen in other patients when we were giving the same protocols, and there were very minimal changes in the weight or inflammatory markers. So what we identified on the further inquiry from the patient, that the patient was not having the regular sleep. She was not getting the regular sleep. It was less than 5 hours every day. So then what we did, we shifted our approach to a Nidra approach. We tried to change her Nidra. We gave her a protocol that will help her to maintain a proper bedtime and give us more relaxation, etc. So this is a very short of that part of that protocol. So results were obviously astonishing. Why? Because the sleep was then corrected. So she was able to sleep for 7 to 8 hours. And there was a weight change, of course, 5 kg loss in 2 months, which is which is not too high and not too less as well. And there was change in BMI, inflammation and IL-6 levels. And gut microbiota was also improved, that we took this biomarker. And also, we also saw that there was change in other complaints as well, like the cravings, the energy levels. Overall, there was, this is the whole discussion that I want to do. But the conclusion of this discussion is that Nidra emerged as a missing pillar that we were not approaching initially, but it is a very important aspect when it comes to obesity or any metabolic disorder. And the probable mechanisms that would have been involved is these. There can be HPA overactivation, and it might have led to irregular Agni and Kapha and Meda aggravation and insulin resistance, and which was corrected when we got the sleep restoration. Then there was appetite normalization, gut microbiota was normalized, and then the patient was able to lose her weight. So there are so many scientific validations to this as well. But to my fascination, I've not found any, Ayurvedic, they were all conceptual. So these are all the references that I've quoted and I've gone through. And yeah, this was related to Ayurveda. I was able to see many results, but they were not any RCT studies or something like that. But when we look into the modern studies, there were so many studies which were like, anyway, so I want to say that even in Ayurveda, Nidra is given very much importance, that even if you're having all the physical activities, ahara is balanced, everything is balanced. But if the proper time of sleep is not balanced, then you can, land up into either obesity or karsha. This is mentioned in Charak Sutra 21. 51 shlokas there. So conclusion is the Nidra is a very important aspect of your life, which is very well explained in Ayurveda. It's just that we need to go back into that, and we need to have a proper evidence for that, so we can advocate that Ayurveda has already described this thing long back. Anyways, these are all the references. Acknowledgement, I would like to acknowledge CCRS for letting me present this, NIA and or the patient, my guide, and thank you very much. Hello. Yeah.
Yes, ma'am.
Yes. And Dr. Amulya,
Yes, ma'am.
what was the treatment protocol followed?
Yes, ma'am. I'll show you. I'll show you a very short protocol that we have given. There was a very long and detailed protocol, but my guide.
When you are presenting your protocol, I think you have to be clear with the protocol that you have planned and how long it has been planned and what
It was planned for 8 weeks, ma'am, and this is the protocol. This is the short version of the detailed protocol that we had used. So my guide wanted me to just show you the short protocol. That's why I've mentioned here. It was just for the 8 weeks. Yes, ma'am.
And did the patient follow the same protocol even at home? And how
Yes,
did you
ma'am.
make sure of it?
So since it was only one patient, so I was constantly, in touch with her through phone, and we were like, she was very interested and in this thing because she's not from India, she's from outside, so she was very much intrigued and interested in this. So it was from her side as well that she followed it. Whatever I was telling her, she was following it. So that is why we were able to get these kind of results. And I was after her, of course. Yeah. Yes,
And
ma'am.
how did your protocol clearly make any impact? I mean, what is your scientific justification for that?
Ma'am, we were able to see a lot of results in that. Like, I'll show you just a second. There was a weight change in that. 1 second. Yeah. So there was a weight change, which is very optimal.
Yeah, I
think.
saw all these things. Yes, I saw all these things. See, but when you're presenting a case, I think you have to be very, do not present a vague thing. You have so much of data. Why don't you put it in order and present? And towards the discussion, you went on becoming very vague in your discussion.
Because of the time
So that's
constraint, ma'am, but I have I have written it in very detail, but since I'm getting five,
see,
5
this was
minutes, so
my
I thought of
observation,
like,
and I think you can change it next time when you present.
thank you so much, ma'am. I will definitely change it. Yes, ma'am. Thank you so much.
Dr. Amulya, your presentation was good, but as only concentrating on sleep, not means what was the protocol adopted for a nutritional aspect or controlling the caloric, all those things you should project it. Otherwise, we won't understand actually. You are projecting the case, a very one single case, but what are the total methodology you have adopted that should have been projected actually, the duration and pertaining to different aspects, because it's only concentrating on sleep. Is it sufficient for
Sir,
that?
yes, sir. That's what my idea was, because the thing is, there's so many researches, so many things that has been done for ahara and physical activity, but my concentration is specifically on sleep. We have mentioned ahar protocol, like there is ahara protocol that we have specifically taken, but my concentration was sleep. Why? Because as soon as we shifted our approach towards sleep, there was a drastic change. So I wanted to highlight that. That's why my focus was on that. It's not that we did not focus on ahara or whatever caloric things over there. We did focus on that, but yeah, this my presentation was more inclined on sleep, because I wanted to bring out the importance of sleep. What I wanted to conclude here is, although we are going through we are trying to maintain ahar, physical activity and everything, but when the real change that came in this patient was only when we made a protocol that was related to sleep, and when the patient was able to follow it. So that was my idea, sir. And you're absolutely right. I should have mentioned a bit of ahara protocol as well, but because I was getting only 5 minutes, so I thought of just concentrating on sleep. Yes, sir.
Okay, Dr. Anga. Sorry, Dr. Amulya.
Yes, sir.
Okay. Thank you. Thank you for your presentations.
Thank you, sir.
Next is Dr. Anga, Anga Lakshmi.
Hi, sir. Am I audible, sir?
Yes, sir, please.
Slide is visible now.
Yes, it is visible. Please. You can start.
Can I start? Okay. Very good afternoon to all. My topic is mindfulness as an adjunct intervention for obesity associated with stress. Introduction. Obesity is a growing public health challenge due to lifestyle changes, urbanization, and dietary patterns. Chronic stress is a key contributing factor as it worsens HPA axis activating, leading to an increased cortisol level and end up in a long-term weight gain. In Ayurveda, Manasika bhavas play an important role in Staulya as Rasazadu is impaired by stress. This is explained as Chindyanamcha Adichindanat. The rationale of the study, the obesity and stress is bidirectionally linked. Conventional treatment often targets metabolic correction, neglecting the psychological components, and Ayurvedic intervention along with the Sattva protocols like mindfulness therapy can address the psychological component. This combined protocol may offer a holistic model for a better outcome. The aim of this study is to establish an integrative model of stress reduction with Ayurvedic intervention and mindfulness therapy in obesity. The objective of this study is to evaluate the add-on effect of mindfulness therapy in obesity with chronic stress and to assess the effect in physiological as well as psychological parameters. The research question, does mindfulness therapy as add-on to an Ayurvedic Staulya protocol among 50 participants in 45 days have significant efficacy in reduction of stress and obesity markers in adults aged 18 to 16 years diagnosed with obesity and moderate stress attending the IPD of EPSV Ayurveda College, Kottakkal. The methodology is given and diagnostic criteria is BMI of 25 to 13 and waist hip ratio for men greater than 0.9 and for women greater than 0.85. PSS score will be assessed by PSS stress scale and it will be moderate stress 14 to 26. Inclusion and exclusion criteria are given and ethical clearance will be obtained for this study. The intervention in both group Maranadi Kada for 40 days along with Triphala Gugulu 1 VD for 40 days will be given and Uttartuna with Kolagulatadi Churna for 40 days and Lekhanavasti for 3 days, that is Triphaladi Lekhanavasti, and Gugulu Rasayana for 40 days will be provided. For control group, no psychological interventions will be provided. And in study group, daily mindfulness therapy including pranayama, sukshma vyayama and mindful eating, thought and emotional regulation will be given for this 45 days. The assessment parameters, both psychological and physiological parameters will be taken and expected outcome is reduction in BMI and waist hip ratio, decrease in stress, anxiety and depression scores, improved mind-body well-being and validation of Ayurveda mindfulness integrative approach for psychosomatic disorders. Going with the discussion, reduction in perceived stress directly improves appetite regulation, reduces craving, enhances emotional stability and support adherence to dietary and lifestyle intervention. Mindfulness reduces cortisol level by regulating HPA axis, leading to restore the homeostasis. And we are also providing Vasti. Here, Vasti acts as a Shodhana, helping achieving Srodha Shodhana, Dosha regulation, Agni Dipana, and Indriya Prasada. In Samyak Vasti Lakshana, it indicates that it helps in successful cleaning and enhanced metabolic efficacy. Guglu possessed with the Medokna, Legan, and hypolipidemic actions, promoting fat metabolism, reducing inflammation, and supporting effective obesity management. Going with conclusion, in moderate to severe stress associated with obesity, stress management is so crucial. The integrative approach aligns with the principle of Sattva Chikitsa and offers a mind-body therapeutic harmony. Mindfulness hormone always promotes Sattva Guna, reduces Rajatama and support mental clarity. The mindfulness reduces stress, enhances emotional regulation, and promote healthier eating habits essential for sustainable obesity management. Addressing underlying stress and integrating stress reduction practice such as mindfulness significantly enhance treatment outcome in obesity. I'm concluding my presentation. Thank you, sir.
Dr. Anagha, is it a conducted study or a proposed study?
Sir, it is a proposed study.
Okay. So what is the basis for this 25 to 30 you are taking, na BMI? Is it overweight or is it obesity or what?
Actually, it is obesity, sir. I took obesity as in this group.
BMI above 30 you are not considered, isn't it? Only overweight individuals you are taking.
Sir, I took obesity because they are giving Varanadi and Triphala Gogulu internally only. Internal medications only we are giving Varanadi and Triphala. That's why I took that category, sir. No more
Is there
internal
any
medications.
basis for this Varanadi Quata? What was the basis for this drug?
Actually, Varanadi is Medakna property. Varanadi Quada have Medakna property. That's why I took Varanadi Quada. And for mainly in Avarana Vikaras, Varanadi is mainly important. When we come to this Taulia, there will be Avarana.
So you are putting the same line of treatment for both the groups, study and control.
Yes, sir.
What is the main difference between these two interventions, two groups? Well, control.
First,
Yeah, tell.
sir, for control group, we are not addressing any psychological components. In study group, we are addressing the psychological components. That is, in both group, there will be, we are taking the sample of stress-induced obesity. So both group will have a stress group. But we are, in study group only, we are addressing that psychological parameter. That's why it is given like that, sir.
What intervention, psychological intervention you are doing?
Psychological intervention, that is going with the daily mindfulness therapy, that is including we will giving a breath exercise of 2 to 3 minutes daily with the Sukshma Vyayama. Sukshma Vyayama can be given for 10 minutes, and mindful eating, that is when we consider our Charaka Jara given Ashta Vidhi Visheshas, we can give that like Ishtadesha Ishta Samibe. That protocol is giving us in mindful eating and thought and emotional regulation. For of the persons with the obesity and stress, they have emotional irregularities. So we can correct their thought and emotional regulation depending on each patient. For many of the patients, we can given with Smriti meditation, that is past trauma can be addressed by Smriti meditation, and emotional regulation can be done by CBT protocols, or we can also correlate solution focused brief therapy, sir. We can do according to the patient. That's why I didn't specify that which we have going to do.
Any pilot studies done in this?
Actually, no, sir.
Okay.
Yes, Dr. Anaga.
Ma'am.
If you are planning to do a work like this, I think you have to stick on to the mindfulness, whatever plan you are doing. You cannot be doing it based on different patients. And it is when you are, yeah, you have to stick on to a protocol. And also, I think you have to do a pilot study. Otherwise, what you have presented right now is a proposed protocol, and that too, I think you have to be still more clear with your protocol, because the main focus, you're a Mansaroga postgraduate, so you have to be thinking about daily mindfulness therapy has to be clearly fixed.
Okay.
Or else the results can be varying.
Okay, ma'am. Okay.
So just do a pilot, and as sir said, you have to stick on to the protocol. Okay, thank you.
Okay, ma'am. Okay, ma'am. Thank you, ma'am.
And Anaga, you can also maintain a compliance chart for this daily meditation therapy, like mindful eating, thought emotion regulation. So all this you should have a compliance chart. How many patients have got complied with it? 70%, 80%, etc.
Okay. Sir, actually, I didn't make it, didn't stick on to some protocol, because when we see this OPD, many patients have different symptoms. That's why I took assessment scale as HAM-A and HAM-D also, along with this perceived stress scale. Some patients show anxiety, some patients show depression. So when we address their trauma, or somebody have trauma, somebody have this emotional stress, that's why I didn't make that protocol. Next time I will do that, sir.
No,
Yeah,
I'm
please.
asking to prepare a compliance chart.
Okay, sir.
That's all, sir. Rajendra, sir.
Sir, one last presentation is there, sir. Dr. Bhumika, I think Dr. Bhumika, are you
Yes.
ready?
Yes, sir. I'm ready, sir.
Dr. Angas, thank you. Thank you for your presentation. Dr. Bhumika.
Sir, is my screen visible now, sir?
Yes, yes,
Yes.
yes.
Yes. Good afternoon, everyone. I'm Dr. Bhumika, second year PG scholar, Department of Kaya Chikitsa, Shrishruta Ayurveda Medical College and Hospital, Bangalore. My topic of presentation is role of lifestyle modification, nutritional strategies, and yoga in improving metabolic health through Ayurveda. These are the contents of my presentation. Introduction. Metabolism is the foundation of life-sustaining chemical reactions within the human body, enabling the conversion of nutrients into energy and supporting essential bodily functions such as growth, repair, and regulations. Metabolic health is the body's ability to efficiently convert food into energy and maintain the balance of blood sugar, blood pressure, and cholesterol levels. In Ayurveda, metabolic disorders are primarily understood as Agni Vaishamyata, leading to the accumulation of ama and imbalance of Tridosha, particularly Kapha dosha and Medha dhatu. In Ayurveda, metabolic disorders can be correlated to Santarpanajanya Vyadhis. Ayurveda's comprehensive approach holds significant promise in managing these conditions. Signs of poor metabolic health includes high blood pressure, blood sugars, high triglycerides, low good HDL cholesterol, excessive belly fats. Coming to the Ayurvedic management strategies includes Nidana Parivarjana, Dinacharya, Rutucharya, Shodhana, Shamanoshadis, Ahara, Yoga, and exercises. Coming to the lifestyle modification, under which Nidana Parivarjana should be done. Then Dinacharya like Abhyanga, Snana, Nidra, Vyayama, which has effects on circulation, hormonal balance, metabolic regulations like Snana, psychological refreshments, mood disorders, Nidra, which helps in hormonal regulation, metabolic regulation, mental health, Vyayama, which improves digestion, managing weight, regulating blood sugar and cholesterol. Ritucharya, coming to Ritucharya, for example, in Hemanta Ritu and Shishiratu, Agni is high and body strength is maximum. So, Abhyanga, Snana, exposure to Atapa, that is sun and warm environment, avoiding of cold exposure and having light food is beneficial. For example, Varsha Ritu, Agni is weak and Vata is vitiated. So, in this condition, using of Ushna Jalas for Snana and Abhyanga and Basti is the main line of Shodhana which can be adopted in this season. Coming to the nutritional strategies, Agni plays a crucial role in metabolism and overall health. Weak digestion can lead to ama, causing various health problems. The primary underlying pathology involves an imbalance in the Agni. Therefore, initial line of treatment should focus on the remedies that regulates and strengthens Agni. So, ama pachana can be done with dipana pachana dravyas, which includes shunti, maricha, pippali, and etc. Once the Agni is stabilized, it should be maintained by proper ahara and vihara. For example, grains which should be included are whole grains, millets, etc. And to avoid our refined carbs, coming to the proteins, legumes, and lean meats and low fat dietary products, and to avoid our heavy oily meats or excessive mixing of protein sources. Healthy fats from nuts, seeds, and other like ghee can be included. What to be avoided is trans fats, fried foods, and other highly processed oils and food. Vegetables which should be cooked and it should be lightly spiced and which should be avoided are raw or cold vegetables, especially for vata doshas. And fruits, fresh fruits, whole fruits should be included. And fruit juices, bananas with milk should be avoided since it is viruddha ahara. So, coming to the next is yoga. In Ayurveda, yoga is an integral part of approach in managing and improving metabolic health by balancing the tridosha and stimulating the agni. Some of the asanas which can be practiced to improve metabolic health include Surya Namaskara, Ardha Matsyendrasana, Navakasana, Bhujangasana, Shashankasana, Trikonasana, and pranayama techniques like Nadi Shodhana, Surya Vedana Pranayama, Kapalabhati, and Brastika. Coming to the discussion, according to Ayurveda, health is the balance of dosha, dhatu, agni, and mala. Improper routine leads to imbalance of dosha, causing metabolic disorders. Lifestyle intervention that combines dietary optimization with yogic practice offer a safe, accessible, and cost-effective adjuvant to conventional medical therapies for metabolic health. Dietary patterns emphasizing high fiber, low glycemic index carbohydrates, unsaturated fat, and reduced intake of ultra-processed foods has demonstrated consistent improvement in glycemic control and lipid metabolism. Concurrently, yoga integrating asanas, pranayamas, dhyana has shown significant benefit in reducing sympathetic overactivity, improving insulin sensitivity, lowering cholesterol levels, and enhancing of life quality. Conclusion: incorporating Ayurvedic dietary principle along with Ritucharya Dinacharya ensures sustainable lifestyle modification and prevention of disease progression. Hence, integrating Ayurvedic principles offers a comprehensive preventive and therapeutic approach for effectively managing metabolic health. Their incorporation into the clinical practice not only addresses the physiological parameters but also enhances patient engagement and adherence through stress reduction and improvement of mental well-being. Thank you for giving me an opportunity to present in this seminar. Hello.
Hello, yes, okay, thank you. Madam, Dr. Savita, madam, do you have any questions? Sir? Shiv-Kumar sir, Ramana sir.
Yes, Bhumika, everything what you told is fine, but what is your contribution?
Sir?
It is just a compilation, right? So
Yes,
have
sir.
you presented a new thing or a new concept? What is your contribution?
Sir, I thought of explaining the conceptual things, sir, which we would incorporate in our patients and
See,
clinical.
Bhumika, wherever there are conferences, in such type of conferences, right? They're all learned people. So you need to present a new things, new outcomes, or something what you have done in your clinical studies, or
Okay.
a new concepts what you can derive from your studies. Okay.
Okay, sir. I'll try to improve myself in my further presentation, sir.
Okay.
Okay, thank you, Dr. Bhumika.
Thank you, sir. Thank you.
Sir, Madam, Dr. Savita, madam. Madam, sir, I request Dr. Shiv-Kumar sir for concluding remarks.
Thank you very much, sir, for inviting us. Of course, the student presented well, but we need to motivate them more for including the references or what the scientific basis on what they are claiming. Few presentations were very good, protocols and all. The rest is fine. And I finally thank Ramana sir and all the CCRS team for inviting me, for giving opportunity to interact with you all. Thank you, sir. Thank you very much.
Thank you, sir. Thank you so much. Dr. Ramana sir.
Yeah, let me congratulate all the presentees who did an effort to mainly concentrate on different aspects of the maintaining of metabolic health, like nutrition related, what factors are to be seen. Similarly, the importance of this physical activeness and also quality of sleep, managing stress. So they have highlighted most of the things which are to be corrected. But among the presentations, I feel that two presentations, one was the case study, that was a little better presentation, and also one proposed study, a clinical study, a controlled clinical study. So those two, the thing is, most of the presenters, they were not having any data to support their claims. So it's a general advice to all the presenters to concentrate and try to get this data which is relevant to their presentation, so that the effectiveness of the presentation will be better. That's all, sir. I thank CCRAs and also CRI Bangalore, Dr. Raghavendra and Dr. Rajendra, who has very well coordinated this particular thing. Thank you very much, sir.
Okay, thank you, sir. Thank you so much. I can totally relate to your disappointment, your and Shiv-Kumar sir's disappointment regarding some presentations were not up to the mark. So hopefully they are just starting in their research career. So hopefully they will learn from the today's session and they will improvise in their future presentation. So I would extend our sincere thanks on behalf of CCRS and CRI Bangalore to Dr. Savita madam, Dr. Shiv-Kumar Karthi sir, and Dr. G.V. Ramana sir for your valuable time and input, and to all the participants for their presentations. So Dr. Savita ma'am is back, I think. Dr. Savita ma'am, please. Would you like to give some concluding?
Namaste. Yeah, I just totally go with what Ramana sir said. Postgraduate students, you need to get up. You have to present with data, and most were AI generated. Please look into the subject as a subject, and learning should be there. which was missing, the data was missing, and I think, as sir said, there were two papers, two presentations. One was a proposed clinical study and one was a case study, which were a bit interesting, and rest all were of the same kind. And now everything, because the world needs an explanation, scientific explanation, and you have to come up with the scientific explanation and data. Then only your papers will be accepted, your publication will be accepted. Please make sure to present in future, to work upon the literature, work upon the data, work upon scientific validations, and then your presentation will be better and even world will accept you. And I thank everybody. I thank CCRA, CRA, and Dr. Rajendra, Dr. Raghavendra, everybody for this opportunity to be a part of this program. And thank you so much, and all the best wishes to young scholars. But you need to get up. Thank you.
Okay, thank you, madam. And thank you, madam, for your kind words. And I would like to invite Dr. Raghavendra Naik, sir, for closing remarks. I think he is there. Dr. Raghavendra, sir.
Namaste.
Sir.
Am I audible, sir?
Yes, yes.
Namaste. Thank you, and thanks for all the experts and chairs and judges for giving your time and participating in this. First time we are conducting this online virtual. We received a huge response from most of the participants, and we organized this online presentations for mainly for PG scholars since last 3 days. We are continuously engaged in this, and thank DG CCRS for inaugurating this, DG CCRS for his remarks, and Sulochana Bhatt madam, Ramana sir, and all the staff and officers from CCRS for their continued guidance and support in conceptualizing as well as successfully organizing and concluding this pre-conference virtual presentations. And thank you all judges. Thank you. My appreciation to all the participants also for adhering to the guidelines what we have provided to them, and successfully concluding this the pre-conference virtual presentation. Thank you. Thank you, Rajendra sir. Thank you.
Sir, thank you so much.
Thank you, sir.
Thank you, sir. Thank you, everyone. We are closing now.
Thank you. Thank you, everybody.
Thank you, madam.
The recording has stopped.